Shall I start, Anilji?
Yes, Doctor. Yes, please.
Yes, Dr. Gulnaz, you can start now.
Okay. Very good morning, delegates. And I will say it's early morning for Sunday. Uh, and a warm welcome on behalf of Samarth Life Sciences. Myself, Dr. Gurunath Sawan. I am heading the medical department in Samarth Life Sciences. Friends, we all know today's situation. India is in the second wave of this pandemic, and the way the second wave has hit India, I think we are into a very troublesome national emergency, and we look at the news channels, and we look at the hospital scenarios, and we see the availability of the beds is going down. There is a problem in the supply of oxygen. Vaccine, yes, it's a very great hope for us, but somehow for our such a huge population, there is still much shortage of vaccine. And when I come to drugs, there are drugs, they are much experimental, and every doctor, whether it is from India or whether it is from abroad, is trying his best to save the life of the patient, whether the scientific proof is there or not there. And drugs like remdesivir, drugs like tocilizumab, which are, now we see in India, people are many doctors are relying on these drugs, and even these drugs are going in shortage. So, do we have any other option left, or do we have a drug, or I will say a dye, which got unnoticed by the world? And that dye is methylene blue. And we have stalwarts, and I will not be wrong to say that they have actually done the PhD on methylene blue. We also have panelists who have conducted clinical trials on methylene blue. We have our panelist, speaker, and the moderator, they are using methylene blue in COVID-19. So what is the role of methylene blue in COVID-19? And does it going to help to save our patient, whether it is from India or entire world? And for this, we have a great panel with us, including the national and international faculties. I will one by one introduce to them. We have today, it's our pleasure and privilege to have Dr. Jagdeep Kakdia as our speaker. He has done MS Ophthalmology, and currently he is associated with Akshardeep Hospital, Bhavnagar. To moderate this session, we have Dr. Ramesh Shah. Dr. Ramesh Shah has done MS Ophthalmology, and he practices in Mumbai. And if you look at the panelist, Dr. Golwalkar, the pulmonologist from Bhavnagar, I think he is the one who spread the awareness of the methylene blue in India. Dr. Golwalkar has done MBBS, DTC. He's a senior pulmonologist, Dr. Golwalkar Clinic from Bhavnagar. We also have international panelists with us. To introduce them, and I would like to say, for few of them, it's a very late in the night. It is past 12. And for few of them, it's too early in the morning. It's 5 a.m. there. So we have Dr. Bharat Bhushan from Texas University, USA. I welcome you, sir. Dr. Saurabh Goel from St. Thomas Hospital, London, and Dr. Alamdari from Mashhad University of Medical Science, Iran. So I welcome the speaker, moderator, and all my national and international panelists. So friends, just a request before we start the session. If you have any problem in the audio or video, you can write it in the chat box and we will take care of that. But if you have any question related to the session, please put in the Q&A, and we will make sure that we will answer all your questions. We would like to spread the awareness of the methylene blue in all the doctors on this globe. So with this note, I once again welcome you all, and I will hand over the session to Dr. Ramesha for moderating.
Unmute yourself. Ramesh, please.
Thank you, Chauhan sir. We have a very eminent eye surgeon from India, extremely innovative, and my extremely dear friend, Dr. Jagdeep Kakdia from Bhavnagar, to continue to start his first lecture on methylene blue used in COVID-19. Over to you, Dr. Jagdeep.
Thank you very much, Dr. Ramesha. Is my screen visible? Please give me feedback.
Yes, sir. Yes, sir. Yes, sir.
Okay, fine. So in our crusade against Corona, which we started, me and Dr. Ramesha, both being ophthalmologists, we started fighting Corona since the day one when it came into India, especially remembering Dr. Li Wan Liang, who from Wuhan was the first physician to identify and declare that this is a new kind of virus and a new kind of pneumonia. And Dr. Li Wan Liang was an ophthalmologist himself, who later on was jailed by the Communist China government and who later on succumbed to COVID infection to himself. So taking his work ahead, me and Dr. Ramesha started fighting the COVID and started spreading the awareness about various ways to fight against the COVID, and we now know that there are 9 short weapons we already have with which we can absolutely, with almost an absolute surety, we can kill and kick out the corona. But before I begin the talk, today is Happy Mother's Day, so Sarva Mata or Sarva Matulya, Oko Mera Naman Dandvat or Vandan. And I express my gratitude and thanks to Samarth Life Science at the outset for gathering this August panel of speakers for a very prestigious webinar. This organization is not that easy to, communicate to all of them and make them available. The situation in India at present is coming like this: Gargar Corona or Gargar Corona. So, to prevent further spread and further calamities, we have to plunge ourselves as best as we can. And we know that this virus is so fragile and it's so weak that even a simple water, soft water, can kill it in about 20 seconds. Whereas we already have the Astras with us in something like Sudarshan Chakra or Brahmastra or Vajrastra. We have very strong weapons with us, with which, if we know them well and if we understand them well, it is so easy to control and kick out the COVID epidemic from India. But it's only that the ignorance in general and ignorance amongst us about the right use of these weapons is lingering this pandemic. There are 9 weapons, but we are going to focus today mainly on methylene blue because, in my opinion, it is the most potent. It is a sword as well as it is a shield. So I'm going to present whatever I have learned from Dr. Golwalkar, Dr. Ramesha, and various other international speakers. Dr. Deepak Golwalkar, as has been introduced, is a very senior pulmonologist practicing in Bhavnagar since 42 years. And he has been using methylene blue for last 12 to 13 years. Earlier, he started using it for multi-drug resistant tuberculosis and extreme drug resistant tuberculosis. He has treated more than 10,000 cases of extreme drug resistant tuberculosis with methylene blue. Then came the swine flu in 2009. So from 2009 to 2011 or 12, we treated about 600 cases of swine flu with methylene blue with very, very, very good successful outcome. And since this pandemic began, he has been treating 70, 80, 90 patients every day. He must have treated more than 6,000 patients on OPD basis with methylene blue with a very, very high success rate and extremely low mortality. Dr. Ramesh Shah in Bombay is now known as Methylene Baba because he makes 500 milligrams and 1 gram methylene blue powder, which he distributes, which the people have to add to water and make their own methylene blue. So he must have saved more than 5,000, 6,000 patients from going into the ICUs just by distributing methylene pudis. The packets of the methylene blue is in iSurgeon in Borivali. I am very, very happy to introduce and to have with us Dr. Darayush Hamidi Alamdari. He is the Associate Professor of Medicine at Masad University of Medical Sciences, Iran. And probably in the world, he is the first person to conduct phase 1, phase 2, and phase 3 clinical trials of methylene blue's use in admitted moderate to severe COVID patients. And we are going to listen from him about his own experience, which is already now worldwide acclaimed and published everywhere. Also, we are very lucky to have Dr. Bharat Bhushan. Anil Bajaj, please pull Dr. Bharat Bhushan from audience into the panel. He's already there in the audience, but he doesn't have the panelist link. So please do something and pull him in. Dr. Bharat Bhushan is an MD. He's a professor of medicine at Texas Tech University at Lubbock, Texas. And he has been working in association with Dr. Alamdari of Iran, and in all Dr. Alamdari's publication, he is already there as an editor. And in spite of United States strained relation with Iran, Dr. Alamdari and Dr. Bharat Bhushan have been able to collaborate and work together on this prestigious project of using methylene blue for COVID-19 patients. We are also very lucky to have Dr. Saurav Goyal, who is an MD physician at St. Thomas Hospital in London, UK. St. Thomas Hospital is a premier institute in United Kingdom, as comparable as to our All India Institute of Medical Sciences, a premier institute where they have started using intravenous methylene blue use for severe COVID disease. He is going to share his experience, and yesterday he gave me a feedback that very shortly in United Kingdom, methylene blue will be given an approval in the NHS to be used for COVID-19 indoor patients. We are going to hear from him today during the panel discussion. And I acknowledge Dr. Anil Patel from Surat, who was the first to start intravenous methylene blue in India, and he has treated more than 200 patients. And all the other doctors' names which I have mentioned here, plus I have received feedback from more than 80 MDs all over India and USA, which I have compiled in my presentation. And recently I have received a feedback from Dr. Rajesh Dere, who is the Dean at Bandra Kurla Complex in Bombay, which is a mega COVID care center. And he said to me that they have used intravenous methylene blue in 300 severely sick patients. The admission time decreased by half. Mortality has decreased from 80% to 25%. So there is a very significant survival rate. And Mr. Rajesh Bhav-Tope, who is the Health Minister of Maharashtra, and Dr. Shubha Raul, who is the ex-mayor of Bombay, are making great efforts to introduce methylene blue as in the mainline therapy. This is the press release which is in today's press from Bandra Kurla COVID Care Center. This is me. This is my hospital. These are my books. I'm a hobby writer, and these are my 8 other books. And having learned so many things from Dr. Golwalkar and having treated few of the patients of COVID myself, I gathered some knowledge and started writing a book. And this is my book, which is now in writing with these many chapters. And I'm going to talk today also in the chapter-wise fashion, so that it becomes easy for all the listeners who do not know too much in depth about the methylene blue to assimilate the knowledge as if they are reading a book. So methylene blue is a wonder drug with a use of over 144 years history, but many qualified doctors are not aware of this drug and its potential. Many of them are not even ready to believe that methylene blue is a drug. And most people believe that methylene blue is a dye to stain cells in laboratories or to color jeans, denim, and cotton fabric. But I would like to bring to your notice that please go on Google and search on Wikipedia about methylene blue. You will find that methylene blue is a methyl thionylium chloride, which is a salt which is used as medication and dye. So the methylene blue primarily is a medication and secondarily is a dye. And as medication, it is mainly used to treat methemoglobinemia. So this is the drug to treat methemoglobinemia. And methemoglobinemia is the condition which is predominantly occurring in COVID disease in severe COVID patients. So methylene blue has a great relevance in treatment of COVID. It has been previously used as an antidote for cyanide poisoning, and it is typically given by injection into a vein. So there are many people, many doctors who do not believe that methylene blue is a drug, but here you can read that it is not only a drug, it is an injectable drug. And it is on World Health Organization's list of essential and safe medicines. I'll describe those in detail. Now, many doctors, when were advised to use methylene blue for COVID patients, they said, "Vishacha prayog काय को करना?" मतलब why to use a poison? Now, here I would like to emphasize that methylene blue is not a poison, but methylene blue is an antidote to the world's deadliest poison named cyanide. So methylene blue can reverse the potassium and sodium cyanide, potassium and sodium nitrate poisoning, as well as carbon monoxide poisoning. And it also is an antidote to altitude sickness. When a mountain climber goes above 18,000 feet, the oxygen concentration decreases from 21% to around 12%, and they start feeling the chronic hypoxia. And that's the same condition with the COVID patient would feel. So methylene blue is an antidote to altitude sickness. These are all the reasons why methylene blue has a relevance in the treatment of COVID. And there are several publications that methylene blue photochemical treatment is a reliable SARS-CoV-2 plasma virus inactivator. And this paper is wonderful by Valeria Kaino and her team from University of Geneva. And in that paper, she has very clearly proven that methylene blue has a potent antiviral activity against SARS-CoV-2, even in the absence of UV activation or light activation. Also, there is a very interesting paper which has come up from Dr. Damir Bojadzik from University of Miami, Florida. According to this paper, methylene blue inhibits the SARS-CoV-2 spike to ACE2 protein-protein interaction. That means the spike2 protein is denatured and the ACE2 receptor is stabilized so that the virus will not get the latching nor the entry. So methylene blue has both the action, it kills the viruses, it prevents the entry of the virus into the cell. And if you look at the US National Library of Medicine and go to the clinical trials of United States registry, you will find that methylene blue treatment for COVID-19 is a phase 2 clinical trial going on in Switzerland and in USA, where they are using methylene blue 100 milligram capsule twice a day for 5 consecutive days in the SARS-CoV-2 indoor patients. And this is the paper which has recently come up in Aristotle Biomedical Journal, in which the principal investigator is Dr. Darayush Hamidi Alamdari. We are very lucky to have Dr. Alamdari here in the panel. I'm so happy to see Dr. Alamdari. It's a very early morning for you in Iran, but we have made you to awake, and we are very lucky. And for Dr. Bharat Bhushan, it's past midnight, around 1 o'clock or 2 o'clock, and both the author of this very, very prestigious paper are here in the panel, and it's our extreme good luck that we have. We also have Dr. Saurav Goyal, who is another author, co-author of this paper. And if you look at this paper, they have been using methylene blue for up to 12 days, about which I think Dr. Alamdari himself will describe rather than me describing about him and his work. Now, this very interesting paper came up last year. It is a paper from the University of Florence, in which they studied a cohort of cancer patients. Now, they studied 6,000 cancer patients in France who were in hospice or who were in terminal care centers. And these are the patients who were on cancer chemotherapy. Now, out of 6,000, 2,500 patients were on cancer chemotherapy where methylene blue was the part of their chemotherapy, because methylene blue is used as part of the chemotherapy for prostate cancer, for breast cancer, and for osteosarcoma. So those patients who had methylene blue as a part of their cocktail in the chemotherapy, none of those 2,500 patients developed COVID disease over a period of 6 months, whereas the remaining 3,500 patients developed COVID to an extent of 75%, and the mortality of those was almost 75%. So almost 50% of the 3,500 people, they died. So this is another proof that methylene blue has a very potent antiviral and anti-COVID activity. And yesterday I got a confirmation from Rajiv Gandhi Cancer Institute and Research Center in South New Delhi, National Capital Region. They have started using methylene blue for the prevention of COVID in the patients who are terminally ill and on chemotherapy at Rajiv Gandhi Cancer Institute in New Delhi. Methylene blue, the first research paper about methylene blue was published in 1893, as early as 1893. There are more than 5,000 research papers which are in public domain, 18 lakhs, more than 18 lakh references, 144 years of use and research, 128 years of publication. And if you go on Google, you will find that there are more than 1 crore references and cross references about methylene blue. And this is methylene blue injection, which is manufactured by Samarth Life Science as CME. This is very freely available in India. There are 3 other companies, Flagship Biotech, Vulcan Laboratories, as well as SG Pharma, who make methylene blue injections available in India in an ample quantity. There are many companies in USA and UK who make methylene blue injections. Methylene blue is also available as 1% solution for the use as food, drug, or medicinal use in USA. This is made by BPH Pharma in USA. It's available for $30 in USA online. Uribel methylene blue capsule is available in USA, also is available as a tablet in USA for controlling or curing the urinary tract infection. Also, methylene blue is available as a night cream to rejuvenate the skin because it has an extremely potent collagen restructuring property. And University of Maryland has studied painting half of the face with methylene blue cream, and you can see the results in 15 days. The skin becomes stout and wrinkle free. Methylene blue is also available as derma blue, solution for painting the skin. Methylene blue is also available as spray mist and also as eye drops. The eye drops are available online. It must be safe. That's why it's allowed as online in USA. And also in Egypt, I found that methylene blue is available as an eye drops. And this is the WHO's model list of essential medicine. Now, this list contains the most efficacious, most safe, and most cost-effective medicines for priority health conditions for the public health. And in this list, methylene blue is mentioned as a specific antidote for methylene blue for the cyanide and nitrite poisoning. And it is to be made available by all member nations of the United Nations as an injection in 10 milligram per ml ampule. And drug repurposing is not a new phenomena in medicine, so we can definitely repurpose a drug if the activity is proven and good, and doctors have a privilege to write with the consent of the paper and for any drug for an off-label use. And Shri Krishna has given us a promise, Sambhavami Yuge Yuge, so I really feel that he has come back in the form of methylene blue, our guardian chakra in our flag, the Ashok Chakra, which guards the nation 24/7, 24 spokes. Now, this is also, you'll be surprised that on our flag, the Ashok Chakra is printed with methylene blue as the vegetable, as the dye. And I would like to just draw your attention that all the savior gods, all our savior gods are painted blue. I don't know why. There must be some blue connection. The Mahadev, the Vishnu, Hanuman, Sri Ramchandra ji, Sri Krishna, all are painted blue. And without knowing the history, we can neither know nor create the future is the proverb. So let me take you to a brief history of methylene blue and what I've learned from my days of medical college. I tried to compile as quickly as possible in about an hour's time. Indigo Fera tinctora is a plant native to India, and this was the plant from which blue dye used to come. Like the plant of henna, when you crush it, it gives you a red color dye with which we paint our hands. So Indica ferra tinctora was the plant cultivated under the British, compulsorily cultivated under the British rule in northeast India. And in 1859, there occurred indigo revolt by the farmers because the land was getting spoiled by the cultivation of Indigo ferra tinctora. And as a result of this great rebellion and revolt, which is very famous as Neel Vidroh or Indigo Revolt in Indian history, independence history of India. So this dye which was going from India, the name itself is indigo, the blue dye which is going to Europe from India. So that's why the name indigo. So this dye became very expensive in Europe, and that was the reason why European scientists had to start searching the way how to synthesize indigo in laboratory. And it was Henry Caro in 1876 who first synthesized and made a synthetic indigo in the name of methylene blue. And this was the world's first fully synthesized man-made chemical, as well as the first man-made, fully synthesized man-made medicine and antibacterial and antiplasmotic drug. And Dr. Paul Ehrlich from Germany, he found the potential of methylene blue, and he started using methylene blue as intravenous and oral medication for the treatment of malaria. He was the first to find cure of syphilis using it, first to find the cure for diphtheria, as well as he was the first to make antidiphtheritic serum. He was the first to demonstrate how to stain fungi, bacteria, and protozoa. And the gram staining technique and Neil Jensen staining technique is thanks to him. He coined the name as antimicrobial chemotherapy using methylene blue, and he coined the name methylene blue, magic bullet for the methylene blue, MB and MB. And he saved millions of life. He coined this term for methylene blue as magic bullet. It's a molecule which will kill the bacteria without affecting the human cells. Hence the name magic bullet. He received Nobel Prize in Physiology and Medicine for 1908, which he shared with Dr. Ilya Makhnikov from Russia, who was the first to demonstrate the gamma globulin and the humoral component of the immune system. Dr. Albert van Mostig Murhoff, professor and head of general surgery at the University of Vienna in Austria, who was the inventor of the first aid kit, inventor of the tincture of iodine for the war wound disinfection, and was the prime pioneer of intramuscular injection of methylene blue in 1877. And he was the first to treat osteosarcoma of femur with injectable intramuscular injection of methylene blue into the groin. And Dr. John Henry Clark, who is a very unique physician, he is MD in medicine and he is MD in homeopathy also, who has written homeopathy's Materia Medica, which is equivalent of our pharmacology textbook, in which he has mentioned everything about methylene blue in a full chapter. And Dr. Deepak Golwalkar, from whom I have learned everything, and I have been very lucky to observe him working him, and learning from him. Dr. Anil Patel, as I said, is a chest physician. And if you recall, when we used to develop stye when we were young in school, or when we used to develop any wound of the abrasion, we used to paint our wounds with fountain pen ink. Now, this fountain pen ink would kill the bacteria and the infection would be killed. Because this fountain pen ink, not the ball pen ink, but the fountain pen ink was containing methylene blue. And methylene blue world over is used as antiviral, antifungal, and antibacterial to prevent the cross-infection between various species of the fishes in the aquaria all over the world, the professional aquaria, the municipal, the government aquaria, as well as the private aquarium owned by the private houses. So methylene blue kills the viral infection amongst the fishes, and this is used world over. Now let us check how methylene blue actions, the 10 different actions, are very relevant to the COVID disease. As I said, if you read this paper, methylene blue inactivates the SARS-CoV-1 virus in the presence of visible light, in the presence of 40,000 lux bright visible light. This paper is published from Beijing University as early as January 2005. This is speaking about SARS-CoV-1 virus, the previous epidemic. 6.5 log titer inactivation of the virus means 99.99995% of viruses were destroyed. If the concentration was 1 micromole per liter of methylene blue, it will inactivate in 30 minutes. If the concentration is increased to 5 micromole per liter, it inactivates the viruses 6.5 log in 3 minutes in the presence of 40,000 lux bright visible light. The same findings were reconfirmed by another team from Beijing University on 17th March, and they also mentioned the same, that methylene blue in presence of 40,000 lux light will inactivate 99.9995% of viruses. I'm lucky to be associated with some of those universities. I was a visiting lecturer to several Chinese universities and a surgical trainer for treating glaucoma and cataract surgery, doing peripheral camps in China. So I have seen their photodynamic therapy using methylene blue for AIDS. This is another paper which came up from Russia, from Viktor Siachenko. They have also found the same, that photodynamic therapy with methylene blue inhibits SARS-CoV-2 virus profusely. I'm also a visiting lecturer to several Russian academic institutes, and I also do assist surgeries and learn many things from Russians. So if you take 5 micromole per liter solution of methylene blue according to the body weight, and just stand in the day sunlight, midday sunlight is having 1,07,000 lux. So we need just 50,000. So if you just stand, take a methylene blue and you stand in the bright sunlight for 3 to 4 minutes, all the viruses in your nose and throat will be destroyed in about 3 minutes time. Now, methylene blue is virucidal by it kills coronavirus by oxidation. Almost all the RNA viruses, not just coronavirus, it kills dengue, chikungunya, hepatitis, and so many RNA viruses are oxidized. So methylene blue basically is an electron donor. So it's not a donor, but it actually bombards electrons. So consider it as an electron gun, and in a matter of few minutes, it can kill the viruses. So it is virucidal. And this is the reason why I would suggest to stop methylene blue. Prophylaxis, if vaccine dose is to be taken, stop 1 day prior and 6 days after the taking shot. Else, methylene blue will oxidize the vaccine viruses also. It does not identify whether the virus is a real virus or whether it's a vaccine virus. It will just oxidize the spike protein and the lipid layer. And then you can restart after 7 day post-vaccine dose. Methylene blue also has a virostatic action, not just virucidal, it is virostatic because it makes the cellular cytoplasm and extracellular fluid into an alkaline medium, pH 7.6 or above. And novel coronavirus doesn't replicate in alkaline medium, it needs pH less than 6.9. So methylene blue is a virus growth inhibitor by this property. Chloroquine and hydroxychloroquine both are step derivatives of methylene blue, and they share and work by the same, this alkalinizing property. And elemental zinc also works on the same principle. And if you look at the pedigree of methylene blue is the great grandmother of, it's the mother of quinine, who is the mother of chloroquine, who is the mother of hydroxychloroquine. So they all share this alkalinizing property. Now, methylene blue, as I said, is also an antiviral entry, means it prevents the endocytosis by inhibiting the protein-protein interaction between the spike protein and the ACE2 receptor. And methylene blue is the great drug for reversal of methemoglobinemia, and that is what is happening in the COVID disease, because the COVID virus, imagine the COVID virus as very hungry virus for converting oxyhemoglobin into methemoglobin, and which is the gradual condition that leads to the happy hypoxia in patients, and then ultimately they go into the ARDS. So methemoglobinemia is reversed by methylene blue. This is oxyhemoglobin, and this is methemoglobin. And if you give an intravenous dose of methylene blue to a methemoglobinemia person, within 20 to 40 minutes, the person becomes pink, from like being a brinjal becomes like a tomato. And methylene blue has an anti-inflammatory property. Also, it is an anti-cytokine because upon chemical contact, it inactivates NLRP3 inflammasomes. IL-6, TNF alpha, interleukin B, beta, and IL-18. So these are the chemicals which leads to cytokine storm. So if methylene blue is used well in time, it can also prevent the oncoming cytokine storm or douse the fire. Methylene blue regulates inflammatory response, and these are the papers about methylene blue's inhibitory effect on NLRP3 and prevention of the cytokine storm. Methylene blue also has a sixth interesting action. It is anticoagulant because it helps to prevent intravascular coagulation by reducing platelet aggregation by blocking nitric oxide and cGMP pathway. So lungs alveolar capillary blockage is also cleared, which helps in clearing the pneumonia rapidly, and it prevents the post-COVID coagulopathies also. Methylene blue also prevents the septicemic hypovolemic shock because in viral sepsis, three chemicals named bradykinin, nitric oxide, and cGMP are secreted, and these hormones causes peripheral blood vessels to dilate. The smooth muscles of the tunica media dilates and peripheral vessels dilate, so the blood pressure falls, and that leads to a vicious cycle of the hypovolemic shock, and that leads to multi-organ failure. So methylene blue has a great role in prevention of the septicemic shock and hence prevention of the multi-organ failure. Methylene blue is also serotonin analog, and hence it is a very good antidepressant, and that's what is needed in the patients because we see that COVID patients who are quarantined or who are in the hospital, they have a great amount of depression, being alone and being the chemical low charge, the chemical imbalance in the body. And methylene blue prevents the depression, so that is also an important action which it has. Also, methylene blue is pan-bactericidal and pan-fungicidal, so being a very potent oxidizer of microbial mitochondria and cell membranes, it can prevent secondary lung infections, and it can also prevent the rhino-sino-orbito cerebro mucormycosis because it's a very strong antifungal. So if intravenous methylene blue or in proper dosage oral methylene blue is used well in time, at par with the indications and dosage as the intravenous that of intravenous remdesivir, if the remdesivir is not available, we'll have the same good outcomes as remdesivir. Plus, there will be no need for expensive antibiotics like meropenem and all those very expensive antibiotics to prevent the secondary lung infection. So a 1,500 rupees course of methylene blue will be more or less equivalent to 1 lakh rupees course of other drugs. And all these 10 actions of methylene blue gives us an idea that it's a very good, almost sort of panacea kind of a drug. Methylene blue, as far as the cost is concerned, is very cheap, but as far as the actions is concerned, it's very heavy. And is in our opinion, it's the real blue dark horse, the workhorse. And there is another very interesting mechanism of action which Dr. Golwalkar has found out. It is the antifibrotic action of methylene blue. It prevents and reverses to a great extent the post-COVID fibrosis. Now, many persons who have recovered from COVID pneumonia have been found to develop slow or fast lung fibrosis over a period of next 2 to 3 months. Interstitial lung fibrosis, if significant, leads to restricted lifestyle and a continuous need for oxygen support. They may need permanent oxygen support. Such patients are also highly prone to other secondary infection because of the fibrosis in the lungs. And US green card or Canadian, Australian, and New Zealand PR is completely denied if they are found in X-ray to have fibrosis. 0.1% methylene blue aqueous solution taken daily as 5 ml nebulization for up to 3 months after recovering from COVID helps to prevent and reverses lung fibrosis to a great extent. This is the paper about methylene blue attenuation of lung injury. And as you can see, all these ground glass opacity areas will eventually become fibrosed when the patient heals. And the methylene blue, the COVID secretion is so sticky, it's a hyaline membrane. So if you look at it in the bronchoscopy, you will realize that the normal influenza, the secretion is frothy and secretion is mucoid, so that patients can cough it out as an expectoration. जैसे बोलते हैं कि बलगम पक गया तो बलगम निकाल दिया. But in case of COVID, the बलगम निकलेगा ही नहीं. There will be a chronic dry cough, but it will not come out. Now look at this bronchoscopic video by Dr. Golwalkar. This is the frothy mucus of a normal pneumonitis or normal infection by any other bacteria or influenza. Now, this is the mucus. Uh, this is the secretion which the patient with coughing will be able to expectorate it out. Now look at this, which is a video, a bronchoscopy video of the COVID. Now you can see that this is something like a fevicol, which has dried up in the walls of the bronchioles. And these sticky fevicol-like membrane or a waxy membrane is very, very difficult to melt. And this is very, very easily broken and melted, oxidized by methylene blue and 3% hypertonic saline nebulization. So Dr. Golwalkar will speak about the advantage of using nebulization of methylene blue and 3% hypertonic saline to break these and make it into a liquid kind of frothy mucus so that patient can expectorate it out. This is the chest X-ray of a patient of Dr. Golwalkar, wherein you can see there's a significant fibrosis in the right lung and moderate fibrosis in the left lung, which after about 20 to 30 days of nebulization, the lung has the fibrosis and the fibrosis has cleared significantly. The left lung is almost gone, and here you can see that the left lung after nebulization has cleared. And this is another patient of miliary tuberculosis with extensive fibrocavitation lesions of the lungs, and this is the same patient after about 12 to 14 months of nebulization by Dr. Golwalkar. This is Dr. Golwalkar's own mother who contracted COVID at the age of 93. She was diabetic. She stopped taking methylene blue after taking the vaccine, and she developed COVID. And this was her picture on 27th March. And after Dr. Golwalkar's own nebulization treatment and methylene blue, this is her lung picture on 2nd of April, 5 days after. So in 5 days, you can reduce the lung edema from this to this. Another phenomena which we all have now started seeing as an epidemic proportion is mucormycosis or the growth of the black fungus. And mucormycete spores are everywhere in the environment, in the house, everywhere. And methylene blue being a very potent antifungal, this fungus is very hungry of energy, so it takes up the methylene blue, and methylene blue destroys the mitochondria of this fungus, and as a result of it, the fungus will start dying. So if methylene blue is used as a nebulization after recovery from COVID, the chances of a patient getting mucormycosis will decrease very significantly. And this is the invention by Dr. Golwalkar and his brother, Dr. Dilip Patwardhan, to add methylene blue solution in the nebulization, in the humidifier, because this humidifier water can give rise to the spores of the fungus going into the paranasal sinuses, and this can lodge, and later on with the oxygen-rich environment, the fungus can start growing. The patients are on steroids, so there's a glycolysis, there is a raised sugar, and the immunosuppression is there. So these lodged spores will start growing, getting the rich oxygen environment and continuous humidity. So adding about 100 ml of 0.1% methylene blue solution as a humidifier in the bottle is a great way to prevent mucormycosis, number one, as well as to give a continuous micronebulization to the patients who are on oxygen therapy and reducing the load of the oxygen demand. An ounce of prevention is worth a pound of cure, as is said by Benjamin Franklin. If we open our heart and mind to methylene blue and start reading about it, we find so many references and so many papers. We just need to open up our mind. And if we open the mind, we know that it is easy and simple to kill and kick out this corona with the blue sword, which we already have. But there is no cure for there is a cure for a most dreadful disease, but there is no cure for a willful ignorance if you don't want to read about methylene blue. A blind man can be made to see by corneal transplant, but a willful blindness cannot be cured. And if you read about methylene blue and go dig deep into it, you will find that methylene blue has a great potential. It works like a blue magic. And on the behalf of Dr. Golwalkar, I'll present how he suggests the prophylaxis of methylene blue. After this chapter, I'll break and then we'll have the panel discussion of all the eminent panelists, how they use in their setup. So this is on behalf of Dr. Golwalkar. I'm sharing what he and what I have seen him doing. I'm just sharing the information and experiences. We are not making any prescription. You take your decision with your Vivek Buddhi. There is no financial interest in any of the items which we are describing. This is Dr. Golwalkar's slogan, Buri Dawa Agar Lo Nirantar, to Corona Rakhega Aap Se Antar. And Dr. Alamdari, this means if you are taking the blue medicine every day, the corona will remain away from you. Buri dawa agar muंह के अंदर तो corona हो जाए छुमंतर. Means if the corona has come into your mouth, you take the blue medicine and the corona will go away. This is the slogan which are coined by Dr. Golwalkar. This paper we have already talked about. There is enough evidence to prove that methylene blue has a very strong antiviral activity against SARS-CoV-2. Now, taking into the data of this paper from Dr. Valeria Kaino, we came to a calculation that virucidal dose of methylene blue in absence of UV light or in absence of the 40,000 lux light is 0.08 microgram per 1 milliliter. That leads to 3 log reduction of viral load. That means 99.9%. Now 0.1% viral load will be taken care of by our immune system. Now average human body of 70 kilogram weight has 50 liters of water. So that is 50,000 ml multiplied by 0.08 microgram. So that comes to 4,000 microgram or 4 milligram. Now 4 milligram gets diluted and spreads in 50 liters of body water. And a little overdose is advisable because no drug is any day, no drug is 100% bioavailable. There's always a little less absorption, and the quality of the drug always is 98%, never 100%. So a daily dose of 4 milligram of methylene blue is 99.9% theoretically virucidal. So taking a 4 ml of 0.1% solution is preventive. 0.1% means 1 milligram powder dissolved in 1 ml of water. Just remember the equation, 1 milligram in 1 ml. So for this double mutant highly virulent strain, 4 milligram of 0.1%, 4 ml of 0.1% methylene blue per oral once a day is the dose recommended. A little overdose is okay, nothing to worry because the toxic dose is 400 milligrams. So even if somebody drinks 400 ml, after that only the toxicity will appear. So little overdose is okay. So I have started suggesting to my patients and my friends to take 5 ml of 0.1% methylene blue per day. And you can calculate the dose according to the body weight. For 70 kilogram person, it's 5 ml, 100 kilo 7.5, 40 kilo 3, and 20 kilo 1.5. So how to make that 0.1% solution? So this is how I make. I take 1 injection of methylene blue and add that 1 injection into 90 ml of water, and that gives me 0.1% 100 ml solution. The another good way is to take 2 injections and take 200 ml bottle of the mineral water and add these 2 injections into the mineral water. So you have the ready solution for daily prophylaxis. You can get methylene blue injection from various companies. I have given the contact numbers here for your reference. You can take a screenshot. Mr. Tandon from Samath Pharma can supply SM. This is another company near Pune which also supplies methylene blue. If you don't get methylene blue injection, you can use an AR grade powder which conforms to the pharma grade. Now these powder of AR grade are as good as pharma grade, and they are available as 25 grams bottles. And you can ask your science teacher or biology teacher from any school or any science college in your city from where they get the methylene blue powder, because they all have it in their science college. And Mr. Arshad Bhai Shah is a large-scale manufacturer of pharma grade powder in Bombay, and you can contact them. Now here I would like to make you aware that there are 2 grades of methylene blue powder available. One is a pharma grade, another is industrial dye grade. Now the industrial dye is brown in color. When you add this to water, it will become blue, but this is brown because it contains a lot of mercury and copper. So this has only about 82% active drugs. So this is the powder which we should not be using. We should be using the pharma grade powder, and pharma grade powder is a green crystal. It's a greenish blue crystallized powder, and so you take 1 gram of this pharma grade powder. You can use any jeweler's scale or a diamond seller's scale to measure 1 gram, and then add 1 gram into 1 liter of pure mineral water. So that will make us a solution of 1000 milligram in 1000 ml. So that will give us 1 milligram in 1 milliliter. So that becomes 1.1% solution. And this is how I make methylene blue solution for my staff and my friends and my patients who come to me for the methylene blue taking methylene blue. So we add 1 gram powder into a mineral water bottle and just shake it a little. It's readily miscible. It's very easily water soluble. And then take 2.5 ml from it, put it under the tongue and swallow it. Keep it for about a minute for a little of it to get absorbed into the blood, and then you gulp it. And now methylene blue is a pan-virucidal, bactericidal and fungicidal, so it doesn't need any preservatives. So the solution which you have made at home is good for over a year. There's no need for buffer or pH compensating solution because methylene blue is a redox drug. It adjusts its own pH. It's a basic organic nitrobenzene-based azothiazine chemical. It's a salt, so not really a pharma drug. So it has almost an infinite shelf life like a salt. It does not degrade any further. There's no need for refrigerator storage because methylene blue's boiling point is 150 degrees centigrade and it does not decay at room temperature. Uh, at present, I am suggesting 5 ml instead of 2.5 ml because I found that those who are taking 2.5 ml, many of them are coming positive in this second wave in India, which is very contagious. So how do we measure 5 ml? You take one disposable syringe and measure 1 spoon at your home because the spoons at every home have a different size. So you just make sure which spoon of your home is 5 ml, then keep taking that. Or you can use this measuring spoon for which are available for chef for cooking. And if you are having methylene blue, I personally take it 2 times a day because of very large level of exposure. Because methylene blue gets washed away after 12 hours. In 8 to 9 hours, the concentration from the blood starts declining. So my personal recommendation is that if you are exposed, if you are a clinician, exposed to more number of patients, take it twice a day. If you are not exposed, you can take it once a day. Imagine that you have eaten jambu 2 times a day. Don't worry about the blue tongue. You don't worry about it. As long as your tongue is blue, you are protected from the corona. If you don't like the taste, it's very bitter. It's very bitter because it's the mother of quinine. So it has to be bitter than the quinine. So if you don't like it, then you can add methylene blue into about 30-40 ml of water. Add a little lemon. You can add a little sugar if you're not diabetic, and then take it as a sherbet. Slowly gulping it. Allow that to stay on your tongue so that it paints your oral and tongue mucosa. And she is my wife, Dr. Ila, and she has found another very nice idea. Because we keep on traveling very, very frequently. So she makes methylene blue tablets for me. Now it's not available in India. So this is Sitobladi, an Ayurvedic tablet, which is hygroscopic, which is porous. So she puts 0.5 milligrams of injection into methylene blue. 0.5 ml of injection, which contains 5 milligrams. So each tablet is now containing 5 milligrams of methylene blue. So when you are traveling, if you don't want to carry the liquid methylene blue with you, you can carry this tablet and take that tablet and chew it in the mouth every day. This is another tablet, Septiline. She impregnates this Septiline tablet for me whenever I'm on travel, so that methylene blue in my baggage, because it's not allowed in handbag. And if you put it in your main baggage, and if it if the bottle leaks, it will spoil all your clothes. So she makes this for me when we travel. And using a syringe, taking 0.5 ml of 1% undiluted injection, you can impregnate one tablet. Now, this is another suggestion by Dr. Gulwalkar of recent. The nose knows it first is the English proverb, because the viral load maximum is in the nose and the point of entry is mainly in the nose. So he has advised that we should put 2 or 3 drops of methylene blue in the nose also every day evening and every day morning, depending on the exposure. Every day evening, when you come home from the hospital, you believe that you have brought the virus from your clinic. And every day morning, when you wake up, you believe that your wife who had gone shopping yesterday, or your kids who had gone playing with their friends in the ground, they have brought the virus, and during the night, sleeping in the same bed, they have given you the virus. So you want to kill this virus 12 hourly. So do it 2 times if the exposure level is that much. Do it once if the exposure level is low. You can use any of these bottles for putting the nasal drop, the same solution, 0.1%. It is slightly irritant, but in about 5 to 7 minutes, the irritation goes away. You can use this set for measuring the dropper as well as the measuring spoon for 5 ml. And now, this is another very interesting suggestion and innovation by Dr. Gulwalkar, that if methylene blue inhalation is taken, it goes right up to the lungs as well as in the paranasal sinuses. So this is Dr. Shubha Raul's video, how to take nebulizer, take 5 ml of methylene blue and close the cup. So one time you inhale from the nose, second time you inhale from the mouth, so that your nasal mucosa, your paranasal sinuses, your tonsil, your throat, as well as your lungs will be covered with methylene blue in about 10 to 15 minutes. So Dr. Shubha Raul, she goes into COVID ward very often. She said me that her daughter is also an MD and she is treating COVID patients. So mother and daughter, both the doctors, they do this since last 7 months every day in the evening. And in spite of coming in contact with 50, 60 COVID patients every day, and plus she is a politician, so she is in so much of contact of the people. Uh, she says that they haven't got COVID positive status in last 8 months after using this methylene blue. So methylene blue nebulization is very effective for clearing paranasal sinuses, covering the lungs. You can use compressor-based nebulizer either, or you can use ultrasonic-based nebulizer for that, which is very easy to carry, it is rechargeable and portable. And those are expensive, costing around 3,000 rupees. So I found another very cheap and simple portable alternative from Amazon, and this is how I use it. This is rechargeable with any mobile charger, any Android charger. Take 5 ml of methylene blue in this cup, lock it, and invert it, and then when you press the button, it will start spraying 0.3 microns mist, nebulized mist of methylene blue. And you can see here that methylene blue is being nebulized, which is seen on the tissue paper. You can take this and keep on taking deep inhalation so that it goes right up to your lungs, and then take deep inhalation so it goes into your paranasal sinuses. Your mouth becomes blue, so do it in the evening. And as soon as it's over, if you wash your face within 2 to 3 hours, that blue staining will be gone. So this is another good alternative for nebulization. It's available for around 170 to 200 rupees to 300 rupees on Amazon. You can buy it. And here I would like to clarify that vaporizer is a no for methylene blue, because methylene blue has a boiling point of 150 degrees, whereas water will boil at 100 degrees. So vaporizer is only for volatile oils which have 60, 70 degree boiling point. So methylene blue will not boil. Only water will boil. So if you finish the entire quantum, you will realize that all the methylene blue powder has stayed back in the vaporizer. So we have to use cold mist formation in the form of nebulizer and not the hot steam vaporizer. So just be sure about it. Now, the question is, does it really work? Does the prophylaxis work? Yes, because we have more than 1,000 friends and their families who have taken methylene blue from us. And we have been following all these 1,000 friends of mine and Dr. Golwalkar and their families for last 9 to 10 months, and we have seen that none of those families have come positive. Some of the family members who were not taking methylene blue because of the distrust or because of ashraddha in the methylene blue, those came positive, but those members of the family who were taking methylene blue as prophylaxis, they did not come positive. Of 400 MRs, because we gave methylene blue to 400 MRs, in my opinion, medical representatives are the maximally exposed lot because they are waiting outside every doctor's clinic. They visit 20, 30 doctors clinic of different specialty. They travel from one city to other city. They sleep in a different hotel every night. They eat at a different restaurant every night. So they have the maximum exposure. So we gave to 400 MR Bandhus the methylene blue, and none of them came positive. None of their family members came positive. More than 300 families of our patients who were COVID positive, who had COVID positive members, and we followed more than 1,500 prime contacts. So all those who were taking methylene blue did not come positive. All those who were irregular takers, or all those who were not taking, they came positive. So I mean, taking methylene blue as a prophylaxis is something like taking the pregnancy pill. If you are irregular in taking, you are like a lady who is an irregular on taking contraceptive pill has a chance of becoming pregnant. You can take the virus if you are irregular, but if you are regular, I am almost 99.999% sure that you will not develop COVID disease. And the biggest proof for us is Dr. Golwalkar himself. He is at the age of 70. He works from 9 in the morning till about 12:30 past the midnight. Since last 1 year, he has been seeing 80 to 90 patients. He has never worn PPE kit. He has never worn mask. He has made himself a human guinea pig. And he is actually trying to prove that I'm not wearing the mask, I'm not wearing the PPE kit. And since last 1 year, in spite of treating 80, 100 patients every day, I haven't developed COVID at the age of 70, at the vulnerable age of 70. And not only him, I have seen his staff. He has a staff of about 10 people. The pharmacy on his clinic has another 10 people, the X-ray, the CT scan, the laboratory. There's about 100 people working around him in his setup. And I have seen that all those 100 people are amongst 100 COVID patients every day. And none of them wear PPE kit ever. None of them are even wearing N95 mask. Some of them are wearing just a plain, simple, homemade cloth mask. And yet none of them have come COVID positive in the last 1 year. So Dr. Golwalkar himself and his staff is a proof enough for us to believe that the COVID prophylaxis with methylene blue definitely works. And this is not just one city. And in entire India, from wherever I get the feedback, wherever people are taking methylene blue as a regular inhalation and as oral and nasal drops, they have not contracted COVID. Now, we did some experimental study, Dr. Alamdari and Dr. Goyal, and I did this in some of the patients on the rapid antigen test. So because methylene blue oxidizes the lipid layer and the spike protein, I thought, let me test whether that hypothesis really works. So rapid antigen test detects spike protein and the surface lipid. So if a patient is positive today, I give him 2 nebulizations, put the nasal drops, give him oral solution. And then tomorrow, if I do their rapid antigen test, the test comes negative. That means the virus is present in the mucosa and in the oral mucosa have been oxidized. So then we did another set of study in which we put the methylene blue drops only in the right nostril, about 30 of these patients. Left nostril is kept as control. And when we do now, after about 4 hours, when we do the rapid antigen test again, we found that the methylene blue treated nose gives you a negative rapid antigen test, whereas the control, the left nostril, gave us the positive test. That is a proof enough that even in the mucosa, the methylene blue kills the virus by oxidizing the lipid layer and denaturing its antigen. Then I did another set of tests. The positive swab we dipped in methylene blue and then did the rapid antigen test. So the swab, if it is dipped in the methylene blue for 4 minutes and then do rapid antigen test, the antigen test will come negative. But if you do it straight, it will come positive. So there is enough proof in form of observational studies as well as these experimental studies that it does work. So now, as far as the therapeutic aspects are concerned, I think I would stop here, sharing my screen, and let us now hear from the stalwarts. Dr. Ramesh, you will please unmute yourself and moderate the session. Dr. Alamdari, Dr. Gulwalkar, I request all of the speakers, all of the panelists to unmute themselves and let us have the questions and answer session between the panelists.
There is one unusual question has come just now in last 1 year and about 14 months. What is the effect on sperm count before planning the pregnancy, which has never come so far?
I don't know. I haven't come across any
I
such,
said the same thing that you don't know.
such study. No,
Dr. Gulwalkar?
I haven't done that study, so I cannot say anything about it.
We do get some new questions every time. Rest of the thing that questions commons are more like questions which are for diabetic patients, hypertension patients, whether we need to modify the doses or not. And second thing is whether it is safe in children or not. So I said that you wait, all the presentation has got all the questions and answers.
RC, let us do one thing. Since Dr. Alamdari and Dr. Bhushan both are present and Dr. Goyal, they have done the phase 1, 2, and 3 trials, which is internationally published. So I think let us hear from Dr. Alamdari. Please, we would like to learn more about your study from your own, from the horse's mouth.
Thank you. First of all, hello to everybody and thanks for inviting me. Thank you very much for all of you. It's an honor to talk about this matter. You know, the methylene blue is very, very effective, according to my experience, to saving the life, according to the results that I got it from the clinical trial phase 1, 2, and 3. The most important part that we should take into consideration that the COVID-19 patients has a lot of oxidative stress in their body. If you measure that I measure the oxidative stress in their blood, it has a huge amount of oxidative stress. And this is very, very important take into consideration that these oxidants cause the huge damage to the tissue of the body and also cause the emboli and the clotting in the blood, as it is proved mechanism. And you know, methylene blue has two forms. One form is the oxidized form, as you know, it's blue form, and also in reduced form that we called methylene blue as a local methylene blue. That means without color or very, very light color. And the methylene blue in the local form It means that in the reduced form is very, very effective in elimination of this. You know, when you will consume methylene blue goes to your body and first pass through the cells, and in that steps, in that moment, it will be reduced to the reduced form, and then it uh, goes for its action. This is very, very important. You know, if you give methylene blue in the stage of the diseases or progresses, it means that increase the oxidative stress in patients. Then we should take into consideration that we should give methylene blue in the reduced form in order to get much more uh, much more effective drug in this form. We should avoid any imposing uh, oxidative stress in body. As you know, there is a mutual uh, action in the about inflammatory and oxidative stress. If you increase the oxidative stress, it causes much more inflammation, and also inflammation causes much more oxidative stress. And they are mutual action to each others and booster each others. Therefore, in COVID-19 patients, in order to use the best effective of the methylene blue, we should give them in the reduced form. And this is very important that take into consideration. And you know, this form of the blue that given to the patients, in oxidized form, it works also, but it works in the limited of the patients, not all of them. And if you give them in the oxidized form, in the blue form, certainly maybe put the patients in more dangerous situation. I think it is very important to give them in the reduced form. And the mechanism that, as Dr. Jagdeep told about that, it's really, it can be deactivate the virus. This is very, very true. It can be reduce the NO production in the macrophage. The most important part that NO production by macrophage cause the methemoglobinemia in patients, and it have huge amount of NO production that goes to the blood, and by seroplasmin in blood converted to nitric oxide, NO2, and NO2, and goes to the RBC and oxidize the ferrous and converted to the ferric form, and methemoglobinemia increase. And as you know, it is approved mechanism that methemoglobinemia could be converted by reduced form to the hemoglobin. It means that ferric forms converted to ferrous form, and then the oxygen can bond to the iron, and iron of in the ferrous form, and you increase the oxygen of the patients. I will try to show, maybe I could show some patients that I did it, that they are about to intubation, and I saved many life of the patients that the remdesivir and favipiravir and interferon beta, they did not give the respond to all therapies that already done in all the world, and I saved them as a rescue therapy, as a last option of treatment. Maybe I can show one patient that I did it. I will try that. Okay, let me I try. Mm, I don't know. I can show the.
Sir, you have to share the screen.
Please share the screen.
Yeah. Is it the? Could you see the screen, my screen, or not?
We can see you, but not your screen. So you have to share the screen and put that whatever you presentation you want to do it. You can
Share a
join.
screen.
Share the
Okay.
screen.
Okay. 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 I'll,
There's a green button at the bottom with an up arrow.
yes, it's green. Green. Okay.
So you can click that, and that will open your screen to the people.
Okay. Do you see now right now or not? I don't know. You see this?
No, we cannot see.
So
You see?
after you click the green button, there'll be 3 or 4 screens that come. You'll have to select one of the screen and then click share. So there'll be 3 steps you'll have to follow. First, click on the green button, share screen. It will open up a window. The window will have a lot of all the files that are open. Click on any one of them and then click share.
Oh, already you see some things or not?
No.
Currently, we don't see
We
it.
not see?
No.
Do you see?
No.
No, you will not see. Okay, I don't know why there is some problem. I cannot share my screen.
Maybe I can ask till then, how do we get methylene blue in the reduced form?
Yeah.
Try now, please.
Yes, you know,
Try screen once again, sir.
I will explain that, you know, I want to explain about one patient that I did it. It was about the intubation. The patient gives all drug remdesivir and favipiravir, and the SpO2 of the patients was 82%, and 1 hour after giving the locomethylene blue in reduced form, it SpO2 oxygen of the patients goes to 95%, and then after 4 and 5 days administration of locomethylene blue, patients converted to the completely healed, and it's released from the disease and discharged from the hospital. The locomethylene blue should be have some excipient inside of that, like vitamin C and other things that converted the methylene blue to locomethylene blue. And also, I want to draw your attention to this important matter that this virus has some other pathological aspect that cause the disease. Methylene blue can eliminate the virus and can increase the oxygen by converting methemoglobin to hemoglobin, and preventing NO production or NO synthesis in macrophage. We should consider also other important pathological process, and also I found other important excipients that I added along with methylene blue that really it saved many patients. And as you asked about the methylene blue, there is a special formulation that should be uh, made by a pharmaceutical company that converted methylene blue in leukomethylene blue forms by adding vitamin C and N-acetylcysteine and so on. Do you have any other question?
Yeah, I heard, Dr. Alamdari, I heard that you have a patent on production of the leukomethylene blue. Is there any chance that in the public interest, the leukomethylene blue is going to be available freely?
Yes, you know, it should be produced by a pharmaceutical company. The price is not goes very high because if the pharmaceutical company produce it, it can give to many patients in all the world. This is, but it's very important take into consideration the blue form increase the oxidative stress, but the leukomethylene blue, as it is in the reduced form, and when it goes to the body, it don't need to be reduced, and already you give to the patients reduced form, and no oxidative stress, no increasing the inflammatory process, and it should be a pharmaceutical company produce this as soon as possible in order to give to the patients. It is, I think, the methylene blue because it's a very inexpensive drug. It is a cheap drug, can be available freely by the government section to the people, I think.
Dr. Alamdari and Dr. Bhushan, do you want to share the results of your phase 3 trials just so that we understand how the success was with what the patients you treated?
Yes, I love. I will give to Dr. Bhushan to present it. As I understand, very late at the morning, I did not prepare the presentation, but I have until now. I want to say I had 46 patients that they did not give response to standard treatments according to FDA approved remdesivir, favipiravir, and interferon, and the SP2 decreased very much, about 50 or 54%, and I started to give them methylene blue, and after giving, leukomethylene blue, after giving leukomethylene blue to these 46 patients, 40 patients are saved, and just 6 patients died. And these 40 patients are expected to die too, but leukomethylene blue saved them. And I think it is very important to start from beginning that the patients are hospitalized or at the beginning of disease, as you can use this form. It will help very, very much. As I am working with the COVID-19 patients, anytime myself, if I feel catch a COVID-19, I will start it using this locomethylene blue. With 1 or 2 doses, I will recover completely, because I started from beginning of the disease. And also my colleagues use this in this situation. And the most important part, locomethylene blue has no very side effects that we are worried about that. You know, the just it that in all case turn the color of the urine to blue color, but by stopping the using after 4 or 5 days, it the blue color turn to the colorless urine. And as I saw, in clinical trial that I did it in the phase 2, I decreased the mortality rate 10%, about 10%, and also in clinical trial in phase 3 that I did, it was the same decrease of the mortality. And also other pathological process should be considered in this matter, that I add some excipients to this methylene blue along with that converted to locomethylene blue, and really it saved many patients. It saved many patients, and this is the logic that we should use this as soon as possible to save many people.
Sir, do you have a difference of efficacy between the leucomethylene blue and the original methylene blue, the efficacy as far as the COVID treatment is concerned, the difference between the efficacy between the two of leucomethylene, or which is slightly better as far as the efficacy is concerned?
You know, when you using blue form, methylene blue, when we are using blue form is an oxidized form of the methylene blue. And as you know, the COVID-19 patients demonstrated that there is highly oxidative stress in them. When you use the blue form, you increase in some patients that they have this high oxidative stress in them. You increase certainly the oxidative stress in them. And as you know, the oxidative stress has a mutual interaction with inflammatory. You also increase the inflammatory in patients. That is very has a bad effect in patients by increasing the oxidative stress, and also it goes to increasing the inflammatory. But if you give the locomethylene blue, it means that you don't impose any oxidants, any oxidant agents or oxidative stress to patients. In vice versa, you decrease the oxidative stress. As you know, the oxidative stress decrease and inflammatory also decrease. And this is very important.
Can we get a leucomethylene blue from Iran in the powder form as we have in the methylene blue, that is the blue one? Can we get the leucomethylene powder from Iran in our country?
You know, a pharmaceutical company should produce this special formulation that give the leukomethylene blue. You know, it is very, very important that a pharmaceutical company produce this leukomethylene blue. I think it can be done. Yes, it can be done. And
what percentage we should use methylene leukomethylene blue?
You know, the percentage that exactly our friend Dr. Jagdeep told us. You know, the dose that Dr. Jagdeep told us is completely correct. Just it should be considered that we should use the leukomethylene blue form. You know, if you use the blue methylene blue, it goes to the body and it converted to the leukomethylene blue. Okay, my body, your body that are in the natural and in healthy situation, there is no problem, and it is okay for us to use the blue form and oxidized form, because our antioxidants in our body are so in the good situation that convert this all blue form to leukomethylene blue. But the patients, COVID-19 patients, face the highly oxidative stress, and they cannot convert this blue forms to leukomethylene blue. They cannot convert the oxidized form to reduced form. Therefore, it is very bad for them. For us, no problem. But for patients, you impose a oxidative stress, and later it goes to the inflammation.
Dr. Saurabh, do you have the experience of this leukomethylene blue?
No, Dr. Shah. So I just want to correct a few things. I'm also an eye doctor actually here in London, and we would like to have a proper randomized trial. Really, that's what's needed. And to be fair, in India, there are so much cases at the moment. That should be the place where we should be conducting this trial. So my friend and very good friend, Professor Deepak Saxena from Ahmedabad, he is now conducting a case-controlled study on this for patients in Ahmedabad. So that is the first step. So where we should see at least, if there is a difference in the patients who have been treated with and without. And the next step after that should be really a proper RCT, because when I talk to people here in London, they will not use this till we have a proper RCT and a large scale RCT. So that is the need of the hour. So all the panelists, all the people in influence, that is what we should be pushing for. I have personal experience. My wife's uncle was admitted, 30 liters oxygen requirement every minute. Everything he has had, tocilizumab, remdesivir, nothing was working. 2 days of methylene blue inhalation, and his oxygen was down to 15 liter. And after another 2 days, 5 liter, and he got discharged after 7 days. And my other people I have treated as well, like that, family members. But this is all empirical treatment, as we all know. So because I don't have a proper RCT to show to them, we have so much experience among our panelists. But when you go to scientists, when you go to leaders in the field, they want an RCT. So in my opinion, that's the need of the hour, a proper long-term or even a short-term, but large-scale RCT. And India is the place to do it, really.
RC
randomized control trial.
Yeah, but that's going to take a very long time. So
I would like to add something.
Yes, sir. Yes, Dr. Bhushan, please.
Yeah. So the study which we're talking about, it's a small study, and as Dr. Saurabh said just now, we need large studies and randomized control trial. But what we are seeing, Dr. Golwalkar is having one of the, I think, one person in the world who may be having the most experience in dealing this methylene blue as such for the last 20 years. And as he has demonstrated into his pictures and x-rays, the changes which has happened in the patient's condition, as well as the preventive aspect. I was not aware of the preventive aspect earlier. So I think the right time to do the RCTs. And secondly, because the prevention is the need of this time. And as you mentioned into your slide, that 4,000 families, 4,000 patients, and 400 medical representatives who are exposed to this virus day and night, none of them developed the COVID. So that itself is a good observational study.
Doctor,
That's what I would like to say.
Well, did you have a whatever small experience you have with blue methylene blue or leukomethylene blue?
So I have
with blue methylene blue. Yeah.
Methylene blue, yes, methylene blue. So currently, I'm talking to the patients and their families and my friends and the doctors in India every day. And several of the patients, we are just using the regular methylene blue as we were all discussing. And we found a great result. Yeah, we found a great. And the earlier that you start, once the patient is hospitalized, then if you start IV, the better you will get the results. If the patient develops multiple organ failure on ventilator, then the results becomes poorer, but the earlier, that's the best. And if you are using it as a prevention form inhalation, so you will not need hospitalization if you start using that.
Dr. Alamgari, can we get a small sample of leukomethylene blue from Iran before we start manufacturing with our pharmaceutical company as a trial in our country? A small amount of leukomethylene, can you give us as a help before we actually start manufacturing the leukomethylene blue?
Yes, I think we can. I will manage with our headquarter university to produce this and send to you if you give your address, and I will try to send to you. Okay.
Dr. Kakdia will organize, and you can send it to Dr. Kakdia, or Dr. Golwalkar will come in contact with you,
okay,
so that you can supply, okay, so that we can make some amount of a beginning here in India.
Yes.
RC, I would like to take one opinion from Dr. Alamgari. I have found one small, simple way of converting methylene blue into leukomethylene blue at home. Yep. And I would like to show it to Dr. Alamgari, and if he can, maybe he can say us that in the meantime that some pharma company starts producing it, can we do this? So let me share my screen. So this is vitamin C chewable tablet, which is available as 500 milligrams. And when I put methylene blue on this tablet, in about 12 to 14 minutes, the methylene blue gets converted into leukomethylene blue. And then I ask the patient to eat this tablet. So this will contain vitamin C and the leukomethylene blue. So this is what I have found as a kind of a home remedy to produce leukomethylene blue. This is the methylene blue 0.5 ml injection. Undiluted 0.5 ml injection put on vitamin C 500 ml, and it gets converted in about 14 to 15 minutes into leukomethylene blue. There is another tablet available in India as Exovit C. Now, when I put methylene blue drop of 0.5 ml on this tablet, in about 15 minutes, it gets converted into leukomethylene blue. And there's another tablet which is known as Zinco Seed. This is containing zinc and vitamin C. And when I put methylene blue on this, it gets converted into leukomethylene blue. So we would like to have your expert opinion, since you are the authority on leukomethylene blue, whether this idea as an interim relief is a good idea or not?
Right now, as I see, it is converted to leukomethylene blue because it lost his blue color. But the amount that you can add on this tablet is a small amount, and the body of the patients need more methylene blue. This small amount, as you presented in your presentation, you told it's not effective amount, and we should certainly produce it just a pharmaceutical company in India produce this. Then you will have the enough dose for patients. I want to draw your attention. As I saw, your mouse is blue form, but if you use the leukomethylene blue, you will not have the blue color in your mouth because already you converted all this methylene blue to the colorless or reduced form, and the dose that it is used just putting a drop on vitamin C. Yes, it is okay that it is converted to the methylene blue, leukomethylene blue, but this amount is not enough dose for fighting against virus. And also, I want to draw attention out to, I found other pathological, other biochemical aspect in pathology of the disease. And it is this, for 1 year I am working in this field, and methylene blue is good for some part of the patients that rescue, but we should consider also other biochemical aspects in pathology of disease. And I am writing the paper of them, and in this new formulation that I have, that I will send to Dr. Shah, that ask and you, this also has, this component also has other pathological, biochemical aspects in pathology of COVID-19. The methylene blue is good, but it is not enough. We should take into consideration, if we want to save much more patients, we should consider other biochemical aspects too.
Dr. Kakdia, can we mix 1 ampule of methylene blue with 1 ampule of vitamin C and mix it and then give IV, which will be sufficient dose for giving intravenous injections?
I don't know. We have to do some experimentation on that.
That is a bad idea.
I mean, after reading Dr. Alamdari's paper, it was for the first time after reading his paper that I started thinking of converting methylene blue into leukomethylene blue. And in last 2 days, I was just doing this experimentation with 0.5 ml being put on vitamin C tablet. But now that he has commented, the mind and the eyes are now open how we can produce leukomethylene blue in more quantity. And since we are here, the entire team of Samarth Pharma is also here. Maybe Samarth Pharma team can be in touch with Dr. Alamdari.
I think Dr. Alamdari.
Yeah, Dr. Alamdari's team is now visible. Please share.
Yes. I think I could share you with. Okay, you see, this patient has SpO2 82. You see?
Yes.
Okay, I will show you again. I will show NIV with NIV ventilation.
Right.
You see 82, okay? And now I give this special formulation after 1.5 hours. You see the SP2 goes to 95.
Right.
Okay, as you see. And after 6 days, giving methylene blue, it goes to 94 with simple mask.
Right.
This is very important that with the simple mask, we have this. You know, these patients gave remdesivir, favipiravir, and interferon, and there was no response, and the physicians was about to intubate him, and he told me, as a last chance, we will do the methylene and we did for these patients, and we saved his life. And I have many other patients. I showed to Dr. Bouchon, and I sent to Dr. Bouchon the video of these patients. And you know, it is very helpful to rescue these patients. You know, the patients you see, NIV with 82%, and it is very let me show this. Yeah, it is very nice that you will see after 1.5 hours, it goes to 95 with NIV. And after 6 days, it's 94, and with the simple mask. And these patients had the lymphocyte 4%. Lymphocytes was 4, and after these times, it goes up and it reached to 25% lymphocytes.
Okay.
Did you give the IV injection in this? And what? How many?
Oral consumption.
Okay.
I prepare the methylene blue in oral form. You know, when you have the oral form, it will be very safe, and no worry about that. No worry, not at all.
So, Dr. Alamdari, all your patients were given oral only?
Would you please tell me again?
All your patients you have treated in your RCT, which is published, are all given oral only, no intravenous?
No intravenous, no.
Okay.
Please consider, please. It is very important. Please don't give methylene blue IV. If you will give IV to COVID-19 patients, certainly they will die.
Oh.
Certainly. I unfortunately, we had this experience, and please don't do this experience for patients. Repeat. Certainly patient will die if you will give.
What is the dose that you gave orally?
Oh yes, I give orally locomethylene blue.
What dose?
Oh, the dose exactly, Dr. Jagdeep told. The dose was the same dose that Jagdeep told. You know, if you go, I give about 3 milligram per day 3 milligram per day. I 3 times. Each time 3 milligram per kg is, for example, for persons with a body weight 70 kilogram, it's about 200 210 milligram. I should say 3 milligram per kg per day. This is the right answer.
So you don't recommend nebulizer with leukomethylene blue?
You know, for maybe it works for healthy people, but for COVID-19 patients, I had one bad experience and the patient died. I had one bad experience and patient died. Please, I think this is good for healthy people because the antioxidants and oxidants balance in those patients are working very well, in healthy people working very well. But for COVID-19 patients, because it is highly oxidative stress, certainly cause much more oxidative stress if you give the blue form. And you should consider this matter very important, very important.
Thank you so much.
No, you're welcome.
Kakadiya sir,
Yeah.
any other question?
હવે મારું બાકીનું પ્રેઝન્ટેશન તો કરી દઉં તો એમાં બધાને આન્સર આવી જશે.
અને હું આન્સર આપી દઉં પણ
હા,
you to ask Dr. Alamgiri any questions more?
No, I had Dr. Bhushan, would you like to comment?
Dr. Gulwankar?
And Dr. Golwalkar.
સાહેબ તમે કહો કઈ.
Dr.
No,
Golwalkar.
as far as the inhalation is concerned, practically now, once I started advising nebulizer to everybody, nebulizers are running short of, they are not available in the market. So nebulization, in my experience, that is the first line I do give to the patient, sublingually and nebulization. And haven't come across any such side effect or any serious effect of, rather it is the drug of choice. Even if the patient is on ventilator, if in a bad shape, to remove the hypoxia, we give IV methylene blue, but it will reduce it will improve the oxygen status. But if the lungs are not clear, if the lungs are not in a position to supply oxygen, again patient becomes bad. So sublingually and nebulization are to be supported with IV, then only you can expect good results. Otherwise, only IV methylene blue will not help, but nebulization is must. I will, in the beginning of every time, I just say, moment you suspect COVID patient is going to develop COVID, give first injection, avoid the cytokine storm. That is the first thing I will always advise. Only dexamethasone and methylene blue can stop it, can avoid it, and then you get some breathing time and you can start with sublingually and other therapy. But do not hesitate, rather give it a priority to avoid cytokine storm. And because if the cytokine storm develops, you land in trouble, patient is in trouble and you are also in trouble. And I must have treated now not 3,000, but more than 7,000-8,000. But not a single patient I've come across who have developed any side effect or any seriousness after inhalation. Rather, if the oxygen level is above 90, if it is below 90, it is some critical patient, means I have to be more cautious. But above 90, I give them inhalation in my clinic, ask them to purchase a nebulizer, go home. They come after 5 days with very good reports. So nebulization, in my experience, and this is with the corona patient, and tuberculosis, interstitial lung disease, lung fibrosis, none of them have come with any side effect in last 16 years. So nebulization doesn't cause any problem. Rather, it is very safe and very effective, and very rarely I need hospitalization only if oxygen level goes up below 85. 85 to 90 is a borderline. I have to be little cautious. I ask the patient to get one oxygen cylinder, go on taking nebulization, and luckily the 3% hypertonic saline is doing very good job. I ask the patient to go on repeatedly taking 3% saline along with methylene blue and dexamethasone. The results are very encouraging. They come on third day that now oxygen saturation from 85 has gone to 90, above 90. I said, now you are out of danger, no need to worry. So nebulization, my experience is very good, and rather nebulizers are not available in Bangladesh.
May I please ask a question? In the patients that you give the nebulization, what was the percentage of the oxygen in them? You know, you are right. For people that they are healthy, it is good for preventing to catch a COVID-19, to get COVID-19. But for patients that they have a serious hypoxemia and what about them? Did you try for them? Just because I tried just for one patient, and patients unfortunately died. I think we should consider the oxygen SpO2 of the patients, oxygen percentage of the patients, and you know, the oxidative stress in them. You know, it is a proved mechanism that, okay, the methylene blue in blue form or oxidized form, as already it is a proven mechanism and proven document. If you go to internet, it is written oxidized form, blue form. But if, and also it is mentioned that the leukomethylene blue is reduced form. And, you know, just because I had such an experience, I told that nebulization in the leuko. But the other important point that I faced, I remember now, I used the for nebulization leukomethylene blue, but because the oxygen oxidized to blue color, and when the patient inhalated, unfortunately he died. You know, I gave him in the leukomethylene blue form in the nebulization, and when it goes combined with the oxygen, it converted to blue form, a very strong blue form, and after about 3 hours, patients died. This is my experience. I think that we should consider the situation of the patients, the oxygen percentage of the patients, and then we will use the nebulization. I am for the healthy people. I think it works, but for the patients, I think it does not.
I would like to share my experience. Every day I'm getting at least 5 patients with 70% oxygen. Now see what happens if you give nebulization, the oxygen level, because of the fluid congestion in the lung, before it starts working, it goes down. So what I do, I've got a concentrator in my clinic. I have put in that methylene blue as a humidifier, put the patient on the oxygen. When oxygen level goes up to 85, then I give him nebulization with oxygen continuing. Within half an hour, the oxygen saturation goes above 90. To persist it, it takes some time. It will go down again, but patient is out of danger. Then I get some breathing time. Daily, I have been examined. Yesterday, what happened? One patient with 65% oxygen saturation came to my clinic. I started giving oxygen. It went to 85. I was planning to give him nebulization. At the same time, I got a call that another patient with 70 has come. I shifted the patient to asked the patient to come out, started nebulization, oxygenation to other patient. This way, this is the picture, but not a single patient has suffered anything in my experience. Every day, I am getting 60%, 70% concentration patient or with 70% oxygenation. Daily, at least 5 patients. I have to arrange it accordingly, bring the oxygen level to 85, 90. Then I tell the patient, now see, he's in danger. You get one oxygen cylinder, go home with nebulization, 3% hypertonic saline and dexamethasone and methylene blue, nebulization on the clock. 1/3 day, patient gets all right. This is my experience. If it is below 80, despite giving all this treatment, then he needs to be hospitalized and ventilated and that hospital treatment. Otherwise, if the patient maintains 85, after giving nebulization, patient can go home, is going home because the beds were not available. So I was asking them to get oxygen cylinder with nebulization, continue with 3% hypertonic saline and methylene blue and dexamethasone nebulization and take it all right. This is my experiences. Oxidative state, hypoxic state is more dangerous than what I have observed with oxidative stress.
Dr. Golwankar, people are asking what are the doses of nebulizer in relation to oxygen level?
See, depending how much oxygen level patient is maintaining. If the oxygen level is above 90, twice a day is okay. 5 milliliter, 0.1% methylene blue, twice a day with dexamethasone. I am adding duolin also because in some patients, although all the leukotrienes have been consumed by the coronavirus, we hardly get any rhonchi, but sometimes I do get few rhonchi. So I think that there some leukotrienes are still available which can cause bronchospasm. To avoid it, to relieve as much as possible, I am using duolin also. But if it is about 90, twice a day will do. Below 90, up to 85, 3 times a day. But then at the same time, I am adding nowadays 3% hypertonic saline. In this combination, that is very good mucolytic. Patients come out, sputum with blood. Yesterday only I asked my pathologist to see what else I can do to liquefy this thick secretion. Yeah, I asked them to analyze and see what else can help me in liquefying this secretion. But below 85, 90, up to 85, 3 times a day, then you have to, adding more than that doesn't help you. But 3% hypertonic saline continuously is giving very good results. And to clear the lung, yes, to clear the lung.
Dr. Golwankar, can you just clarify that the hypertonic saline is going in IV, or this is the nebulization you're talking about?
Nebulization. 3% hypertonic saline, 5 milliliter every 6 hourly, or in case the patient is bad, then 4 hourly also I'm advocating till the patient start breathing nicely, patient feels that he is now out of suffocation, then you can taper down according to the oxygen level.
Dr. Golwalkar, how much volume of the duolin, dexamethasone, and 3% normal saline you take for nebulization, sir?
Yes.
How much is the volume, sir?
Dexamethasone initially 8 milligram, 2 milliliter. Duolin ampoule, respiules we are available in the market, and methylene blue 5 milliliter. You cannot, you can give separately. I have made some changes in my nebulization because every time it will take longer time. So made some changes in the nebulizer, made some hole with 18 number needle. So it comes out fast and patient doesn't get tired. Otherwise he will get tired. And saline alternate, 3% hypertonic saline, alternate way. nebulization only. 5 milliliter every 6 hours. If patient's condition is good, 8 hourly, or if bad, even 4 hourly, I have to give till patient start bringing out the sputum. Priority I do have, and then only you can help hope for better oxygenation of the patient. Hypertonic saline is an mucolytic, excellent mucolytic. We have been using since years as a mucolytic in tuberculosis to get the sputum. Now I found that this to break down this secretion, it is helping me, and I'm getting very good results.
To all the viewers, hypotonic saline 3% is commercially available. Yes, Dr. Golwankar?
Commercially available. It is accepted by medical for as a mucolytic also. No need of any acceptance or permission from any medical. It is in the books, in the textbooks, an approved medicine as a mucolytic in inhalation.
RC, it is available as 3% pint for treating hyponatremia, acute hyponatremia, to increase the sodium level in case of a sudden sodium loss. It is also available, Dr. Golwalkar. I tried in 1 or 2 patients in a different way. It's available also as eye drops. 5% normal saline is available as eye drops, 10 ml eye drops. So you can use that 3 ml from that 5% hypersol eye drops which are available. If you don't get the 3% normal saline for reducing the corneal edema, it is available everywhere. And also 7% hypertonic saline is also available to reduce the cerebral edema in case of acute brain damage, and also for cerebral herniation in case of severely raised intracranial tension. So you will definitely get either 7% hypertonic saline or 3% hypertonic saline, or 5% hypertonic eye drop in the name of hypersol eye drops. But this is a very good observation and innovation done by Dr. Golwalkar, that because this COVID mucus is so sticky, like a dried Fevicol, that it is very easily broken by 5% hypertonic, 3% hypertonic saline nebulization with methylene blue nebulization. I have some of the photographs in the next 1 or 2 PPTs. So when I show those photographs, all the doubts of the people or the questions will be automatically solved. So once we conclude the panel discussion, I would like to show 1 or 2 quick PPTs. And I also compiled 1 PowerPoint for answering all the questions, which are the common questions we get in every webinar. So I have made those answers so that we don't need to answer them separately. Dr. Bhushan, would you like to add something before we move on to the 1 or 2 next PowerPoints?
Yeah, sorry, Abba. I'm in the hospital. I'm so sorry. I'm seeing the patient at the same time. I would like to just share this. I would like to share my patient's room, but definitely I'm listening to all the conversation. And as Dr. Golwalkar said, and as I said earlier, he is the most experienced person who has single-handedly used methylene blue for so many years. And secondly, this is a stage where we have to prevent so many patients. And the people and the physicians, they are prescribing this, are recommending this for the prevention, then we can prevent the wave of this death which is happening right now. Coming back to the large randomized trial, it will take time. Remdesivir was used. We found that it is not useful. So it takes time. But to save the life, what the Dr. Golwalkar is suggesting, you to use it as a preventive measure and then save the life right now. That is what I would like to add.
Right.
I want to ask one question to Dr. Golwalkar, sir. What is his indication for IV uses of methylene blue? When he will use IV methylene blue, Dr. Golwalkar, sir?
Most ideal, I get a call on 10 days that patient is not responding to any therapy. I will say that it is the third day is the ideal time when the lungs are not in a bad shape, body is responding to little extent. Use on the third day, that will do jobs. Hypoxia will be relieved and the viral load will go away. But at the same time, I always say that always use nebulization as the first and sublingually along with nebulization, because you need good lungs to support. Even if you relieve the hypoxia for the temporarily, if the lungs are not in a position to give enough oxygen again the same crisis will come up. So third day, in my opinion, is the best day to give one shot at least of IV methylene blue, and then you continue with the nebulization and other drugs. But third day is the most ideal, not 10 day when patient is in a bad shape, lungs are totally become a hard stone. When the postmortem studies were done in Ahmedabad, they said that 400-gram lung had become 2 kg lung, that much congested, that much heavy it was. So you don't have any elasticity left in the lung, totally badly congested. To prevent it, you have to start with nebulization first to prevent cytokine storm sublingually. And on third day, in every patient, no need of giving it. But nebulization and sublingually is the must. Some loading dose, Kakdia Sahib has rightly said that some loading dose can be given, but give nebulization and sublingually first of all. You have to give. And third day is the most ideal way, not 10 day.
When you will continue it for longer, sir?
It can be
the IV formulation. When you will continue for 5th, 6th day or longer, what is the indication for that?
3 days are enough, I think, because by that time the lungs start working and they supporting, then no need of giving IV. Because IV is going to kill the virus, but not that the congestion and secretion, they are the main trouble. Once the cytokine storm has developed, it is blocking the alveolar capillary block, it is exchange is blocked. You have to clean it first. You have to attack on that thing to clean it. IV methylene will improve the hypoxia, will kill the virus, whatever is present in the blood. The main problem after 3 days remains is the secretion and alveolar capillary exchange blocking. That you have to concentrate, attack on. See, if you give pressurized oxygen, it will improve some oxygenation, but we have to concentrate again on the clearing of the passages. That is most important. That's why I'm asking even for 3% hypertonic saline, sometimes nebulize acetylcysteine, but acetylcysteine you cannot go on repeating, because sometimes I've seen some more bleeding with that thing. So hypertonic saline is that way more safer than acetylcysteine. Sometimes I do use it. I given him a trial for soda bicarb, that is also alkalizing as well as mucolytic, but I found better with 3% hypertonic saline. But methylene blue IV will improve just hypoxia temporarily, but if it is not provided enough oxygen again, the condition will recur again. So you have to, at the same time, concentrate on clearing the lungs also.
So, can I add a few more points, sir?
Yes, sir.
Yes, yes.
Yes, sir. Yes, sir.
So, if we are talking 2 stages, number 1, the patient is not hospitalized. Number 2, when the patient are hospitalized. Obviously, when the patients are hospitalized, we have to use the IV form. And steroid number 1, first of all. Number 2, the blood thinner, Claxane or whatever blood thinner you want to use. If the patient can take orally, you can use the oral form of blood thinner. If that is also not available, you can use Coumadin. That's also a possibility, because we know that there is a microembolism phenomena going on. And thirdly, when I in the last couple of days, I recommended to use the methylene blue, number 2, N-acetylcysteine, and number 3, methylene blue and N-acetylcysteine, and vitamin C in large doses. These 3 things has helped. That's what I would like to say. And as Sir Golwalkar has said, you keep on increasing the volume, the gas exchange at the local lung level by giving the methylene blue inhalations and hypertonic saline. That's what I would like to add. But as far as the prevention, I will go with the inhalations.
Inhalation and sublingual.
Sublingual, yes, that's right.
Prophylaxis mass level, you can do it 2.5 to 4 milliliter sublingually. And see, last year I was satisfied with only once a day sublingual 2.5 milliliter. But this new virus is very highly virulent. So I have added in the nasal drops also. If you have nebulizer, take nebulization in the end of the day, because in the daytime you are exposed to the virus, it goes into your nose and it spreads very rapidly. So every day you have to kill the virus in the nose also. And see, those who are taking, I have taken history. Sometimes patient says that I have been taking methylene blue, but still why I develop. But single is, if you miss for 3 days, if you go on taking for a year, but if you miss for 3 days, you are susceptible to develop corona. So I get an history. Yes, I had been to Bombay and I'm in the plane. I was not allowed to take the bottle, so I didn't take it 3 days. And then when he returns, he comes with a corona. So you have to take it regularly. That is very important because its half-life is very short. You are protected for the day only. So you have to regularly, that you make it a routine till the pandemic is over. And everybody is worried about those side effects. I have been taking since 2 years for other reasons also, not for the corona. No problem. I am happy and regularly enjoying my life. Till today, right now, because of the pandemic, I feel that in case if a patient comes to me, at least I should give him nebulization first, even at 12 o'clock, because if I don't give nebulization tomorrow, today's oxygen saturation 90, by tomorrow he will come with 85. So I want to prevent the cytokine storm. I am continuing because he has come to me that I feel that I should give him nebulization at least one. So the next day he doesn't come with 85 and in trouble. And that does happen. If you immediately you give him nebulization with this methylene blue and dexamethasone, the cytokine storm is prevented. Then you can ask him to come next day. He's comfortable. Then give him 1 TSF of 5 milliliter loading dosage. Just give him when he comes at 11 o'clock and I'm not in a mood to examine fully. I give him one nebulization and one 5 milliliter methylene blue. Ask him to come next day. In the morning, he said that at night he could sleep comfortably, no problem. Then I examine and do all the investigation and treatment. But one nebulization is must immediately, even if you suspect, if there is no corona, but give nebulization, you will prevent the next day catastrophe. That and it is not going to cause any damage to anybody.
Yeah. So prevention is better than cure.
Yes, prevention is the best way.
Dr. Gulwankar, people are asking that should we continue taking nebulization after the COVID is over, especially when you have a few patches on lungs?
Yes, patients are coming to me with patches. If you see them very minutely, you will see the bronchus line, bronchial last.
How are you?
I had shown the silver lining. Even if corona is cured, see, I would like to show you, give you a very simple demonstration. This is a simple flute. I ask the patient to blow the flute. If he can blow in one breath for 15 seconds, that means lung capacity is quite good. How many seconds? This you can use in OPD or anywhere. For how many seconds in one breath you can blow it? Loudness is not important, but continued cheer. This simple test you can use in your clinic. That is very good exercise also. At the same time, you get to come to know what is the state of affair of his lung. It's just going, go on blowing slowly, but length of time. This is simple test. You come to know how you don't need any lung function testing or anything. You can judge from this simple fluid also. And even if the corona is over, see, I've been using in lung fibrosis. I've been using in interstitial lung disease. In tuberculosis, I must treated XDR patients, those who had no cavities, no destruction, there only I got results. and vitality, immunity of the patient should have been good. MDR in primary, caseal pneumonia, cavitary lesions, photon positivity, confirmed tubercular patient. End of the result, I got many X-rays where there was no evidence that it shows that there was no evidence of any tubercular lesion. Now, that is beyond the basic mechanism what we do have now, nitric oxide mediated in anti-inflammatory process, but there must be some other mechanism which is operating with methylene blue, which is helping me in treating this tubercular patient. Primary MDR, I am confident patient will be 100% all right. In XDR patients, if the lungs are not destroyed, then I can hope for a better 50% result. I do have interstitial lung disease. One criteria I have observed. Why I'm telling you, because even after the pandemic is over, the lungs are bad. Even a scarring is not given a visa. To clear that scarring, you need to give inhalation. In interstitial lung diseases, if the oxygen saturation, if the patient doesn't have clubbing, and if I ask for a 20-meter walk test, if it goes down from 95 to 85, how many seconds he takes to come back to 95? If it is less than 10 per second, I'm sure that he will improve 100%. If it is more than that, I am little guarded. Tell them that you will get benefit. In idiopathic fibrosis, very good result. So whatever in corona, I will not call it as a fibrosis, I'll call it as an interstitial pneumonitis. It gets cleared in maximum 2.5 to 3 months. So that, and these carrying people are denied visa if they plan to go abroad on a permanent basis, they are not given visa. For that, you have to, this methylene blue will be very helpful if you start using right from the beginning. If you develop fibrosis, even if you are cured of corona, that fibrosis will not allow you to go abroad. You will be denied visa. So you have to give nebulization, even if corona you have been declared cured, or to clear that fibrosis, to prevent the fibrosis, to get rid of all the radiological lesions, it has to be given. I will advise it.
Second question common is to both of you and Dr. Jagdeep Kakadiya is that what is a dose to a children in methylene blue when we are expecting the third pandemic, where children are likely to get affected?
Dr. Kakdia has nicely formulated it. I will ask him to.
See, according to the dose which I have calculated according to Geneva University's published paper by Dr. Valeria Kaino, and I have been repeatedly saying that for 70 kilo person, 50 liter is the water volume in the body, for which we'll need 4 to 5 ml. So if the child's weight, so consider 70 kilo and 5 ml or 70 kilo and 4 ml. And a little plus is not a problem because the upper dose is 200 to 300 milligrams. So don't worry much about the exact dosage. This is not something like a very, very precise dosage which we need. But we don't want to be underdosing. We want to be little overdosing because toxic limit is very high. So let us say if a child is 35 kilo, it would be around 2.5 ml. If a child is 15 kilo, it would be around 1.25. And there is a study which I'm going to show you. The study is done by Heidelberg University in a country named Burkina Faso. It's an African country in the Western Africa where they have given 12 milligram per kg body weight intravenous injection of methylene blue to treat cerebral falciparum malaria in children. 226 children were given methylene blue, and the children were aged from 6 months to 59 months. That means this are half a year to 5 years. So as to kids as young as 6 months, you can give. And for pregnant women, you can definitely give the nebulization. There is no harm in giving nebulization.
I think with this, all the questions, most of the questions are answered. Dr. Kakadiya can go ahead with his presentation.
Okay, so this will just cover the common questions which we come across, and then after I finish this, again we'll have a little panel discussion. So what are the common side effects? These are the things which are asked. This is about the leukomethylene blue, the slide which I have said. The common side effects are bitter taste for 1 hour because it's a mother of quinine, so it is very bitter, but you get used to it. Blue tongue for 4 to 5 hours. There is nausea and diarrhea in some of the patients, mild rise of skin temperature and hot feeling, like systemic atropine or steroids you have taken. Because it's a mitochondrial respirator and it produces so much of energy, it actually converts glucose into energy. So there's so much of internal energy produced. It is same as if you have taken a moderate dose of steroid or you have taken one atropine injection. The same kind of warmth you feel. In this winter, when I was taking Methylene Blue every day, I never needed a jacket or a sweater in spite of too much cold. There is a mild rise of systolic blood pressure, 5 to 10 millimeters of mercury. So those patients who are hypertensive, please, they should be monitoring their blood pressure and adjusting their antihypertensive dose because it is a vasoconstrictor. So it will raise the blood pressure. Now, mild to moderate irritation for a few minutes after nasal drops or inhalation of nebulization, because your nasal mucosa, till the time that methylene blue is brought to the normal pH, it will give a feeling of irritation, the same feeling which you will get when there is soap water which goes into your mouth, because this also has an alkaline pH and soap water also has an alkaline pH. So it's the alkaline pH which is dealing with the irritation. There is no major adverse side effects which have been known since 1877. No major side effect has been reported of methylene blue. There is not a single death which has been reported by methylene blue in due to anaphylaxis in the last 130 years. Ocean color urine that every patient has to ignore. So we have to instruct the patient that forget about this. There are some advantageous side effects. Sleep requirement decreases, working efficiency increases, mental as well as physical lethargy. Fatigue and tiredness feeling is almost gone, as if evaporated. And this is one of the reasons why Dr. Golwalkar is a fan of methylene blue, taking it, increasing his working efficiency from 9 o'clock in the morning till 12:30 in the night. And he's an excellent badminton player. He's a coach of badminton. So even after working this much, he coaches several students at the university in the morning. And he's also an excellent Santur player, disciple of Pandit Ravi Shankar. So at the age of 70, he gets a very good kick from methylene blue for working so much in the interest of patient. The pain tolerance increases. This is what I have felt, that your endurance, physical endurance for a fitness workup, and the pain tolerance increases exceedingly, because it is an anti-inflammatory drug working same like hydroxychloroquine. The mental higher function, memory and cognition improves. Actually, it is a new nootropic. It improves your memory and it prevents your occipital cortex memory cells from dying, especially after the age of 60. So if you take methylene blue after the age of 60, you are sure to retain your memory longer. Blood sugar falls by 50 to 70 milligrams in diabetics through increased mitochondrial respiration. So diabetics will have a little benefit. They should monitor their sugar and monitor their anti-diabetic doses accordingly. The mood improves so much, this being a serotonin analog, the mood improves so much that we never feel a black or blue mood. You are always in a good mood, feeling of innocent bliss, a nirdosh Paramanand, which usually only the yogis or Vipassana sadhana gives you. The moment you take 4 ml of methylene blue, and within 15-20 minutes, you will feel that innocent bliss. There are a few doctors who said me that it gives me a sort of a double 007 feeling. So I asked them, what is that? So they say one is that we feel as if we are on cloud 7, and second is that we feel as if we are James Bond. It not only kills viruses, it also kills constipation also. So it's a good laxative. Your teeth will start becoming whiter after 2 or 3 months of use of methylene blue. The caries will be gone, halitosis will be gone, and aphthous ulceration of the mucosa will be gone, because the entire commensal flora of the mouth will be destroyed. And you will notice that next day morning when you wake up, if you have taken methylene blue on your tongue previous day night, on next day morning there will be nothing to clean your tongue. There will be no white candida thrush which grows. So you practically don't need to use your tongue cleaner next day morning. I got feedback from about 150 patients that their children, the moment they start taking methylene blue per oral, their chronic tonsillitis were gone in 2 days, which were resistant to all other antibiotics for 1 or 2 years. They were actually posted, some of those kids were posted for tonsillectomy, but they didn't need tonsillectomy after taking methylene blue. So that is one good feedback. Yeah, the regular use of methylene blue will also prevent common cold, dengue, chikungunya, influenza A, hepatitis A, B, C, Nipah, Zika, West Nile, Japanese, and all RNA viruses are oxidized by methylene blue, irrespective of identity. Urinary tract infections and the pus cells in the urine will be gone. Falciparum or virus malaria will not happen. Senile dementia is prevented. Alzheimer's disease is halted. It also holds Parkinson's disease and Huntington disease. Huntington disease is the disease of the young patient. It's something like Alzheimer occurring at a younger age. You can find so many papers about every RNA virus which is inactivated by methylene blue. So all these Toga virus and West Nile virus, Ebola virus, and all kind of viruses. And let us now go to therapeutics. I quite laugh when the youngsters they say to their girlfriend that tu meri jaan hai. Usko pata nahi hai ki teri jaan kya hai. No, when they develop COVID disease, they realize that no, not the girlfriend, but it is the oxygen wo apni jaan hai. And it is the methylene blue, which is the oxygen giver. You can consider almost it as a liquid form of oxygen. 2 bottles of methylene blue is almost equivalent to 1 whole cylinder of oxygen if you compare the quantum used. So the dosage has already been discussed. This is the nebulization which Dr. Golwalkar has suggested. 5 ml of 0.1% methylene blue, 1 ml of Dexona, and 1 ml of Duolin, either or combimist L. For nebulization, in place of Dexona, you can also use Budecort 1 milligram BID 12 hourly for 7 to 8 days. This has been experimented by Dr. Sunil Thangraj from Visakhapatnam, and he gave me this feedback that it works better than Dexona. Foracort also works better than Dexona. 3 times a separate nebulization of 3 to 5% hypertonic saline. Because this and methylene blue nebulization is the only way to dissolve these crusted and solidified, dried, scale-like secretions in your in the bronchus of the COVID patients. And as I said, 3% normal saline is available to treat hyponatremia. Sodium chloride 6% nebulization. Inhalation solutions are also available. If nothing is available, at least Hypersol 5 eye drops or Solin 5 eye drops are available in every city of India. So you can use this also for hypertonic nebulization. Hypertonic saline 7 ml for nebulization is specially available as Respule, which can be used in nebulizer. And if nothing you get, then you can make hypertonic saline of your own, taking sea salt or an ordinary salt. 3 gram in 100 ml will give you 3%. So you can add about 8 gram of salt in 250 ml Bisleri water, and you can make your own hypertonic saline. Don't worry about the sterility part of it, because the patient is already on antibiotics and everything. So if you don't get anything, you can make hypertonic saline at home. I think prevention and reversal of COVID fibrosis we have already discussed. The paper we have heard everything about from Dr. Alamdari himself, and this is his therapy. And the intravenous use, wherever they have started using intravenous use, I am getting the feedback that their ICUs are becoming empty. You can see that those ICUs which are using intravenous methylene blue, they have very high rate of discharge. The admission time decreases by half and the mortality decreases by from 80% to 25%. That's the experience shared from many people. Even in Mount Sinai Hospital in New York, they are using intravenous methylene blue, and this is their case study, which is online. You can go to PMC and type this number and you'll get this case study. This is Dr. Darayush's first paper on phase 1 trial. And this is another trial wherein they have described how we can prepare leukomethylene blue from oxidized methylene blue. We can read this and learn a little more about leukomethylene blue. Dr. Anil Patel's feedback I would like to share. He says that antiviral property of methylene blue is more potent than anti-inflammatory. Very effective if given in first 3 to 4 days of onset of symptoms. So he says me that instead of remdesivir, or consider whenever the remdesivir is indicated, methylene blue is indicated on the same dosage. The first day 2 injections and then 1 injection for another 4 to 5 days. There are no side effects. It is very safe. If G6PD deficiency is ruled out, it is safe or better virucidal. It has safe or better virucidal action than remdesivir. Remdesivir is only virostatic. Methylene blue is virostatic as well as virucidal. If eGFR is less than 30 ml per minute per this body square meter area of the skin, then avoid use of intravenous methylene blue. And I know there are many ICUs where they use methylene blue as an intravenous infusion, continuous infusion 24/7. The patient's veins will become blue like this by the infusion, but gives very good result. For late stages of severe infection, continuous IV infusion and frequent nebulization to be given 200 milligrams in 24 hours. So 2 ampoules in 24 hours, 1 to 2 milligram per kilogram body weight is the best dose for IV infusion. For IV infusion in 5% dextrose, preferably not in normal saline, because on a longer period when you have to give for 24 hours, the methylene blue in normal saline starts developing crystals and clumping. So if you want to give for a short time, 1 hour, you can dilute in D5 or NS. But if you want to give it as an infusion, continuous infusion, you have to dilute it in D5 rather than in normal saline, because we don't want the formation of the agglutination of the crystals in the normal saline, which Dr. Anil Patel has found that it does develop because of the air conditioning in the ICU, cooling effect of the saline. There is a crystallization which happens in the saline. Monitor hemoglobin, reticulocyte count, and serum bilirubin just to rule out the hemolysis. Dr. Rakesh Karotia has treated more than 400 patients just by using intravenous methylene blue. That is his only therapy. He doesn't use remdesivir ever. He just uses methylene blue IV with vitamin D3C and vitamin C and everything else. The only caution which I would like here to mention is that methylene blue and tocilizumab should not be given on the same day, because they have some kind of agglutination or precipitation effect, and if it is given on the same day, it might lead to acute renal shutdown. So tocilizumab and methylene blue should not be used on the same day. And this is just to inform you that one of my friends group from IIT have developed an excellent alternative to BiPAP or ventilator. This is known as VentiPAP mask. And this mask has 2 inlets, so it operates from oxygen. I mean, it gives oxygen and it operates the frequency by the oxygen's own pressure. So if you have 2 regulators and 2 cylinders, one cylinder will give the oxygen, the second cylinder will give the pressure to operate the valve. So this is a non-electrical sort of a ventilator which is now available. You can contact Mr. Darshan, but it costs around 10,000 rupees. So if you don't have 1 lakh rupees BiPAP, or if the patient is ready to accept the non-invasive ventilation, this is an excellent innovative alternative developed in India, based in Surat. Now we take the FAQ, which are the most common FAQs. Can an ISD or coronary bypass patient take it? Yes, methylene blue has cardioprotective effect, so there's no harm in taking for the patients. There are several papers which mention that methylene blue has cardioprotective effect, and it increases the short-term survival in experimental cardiac arrest. So they can take. Can a cancer patient take it? Yes, because in fact methylene blue does not induce cancer. It is a part of the chemotherapy of many types of cancer, like breast cancer, prostate cancer, and osteosarcoma. Read the following papers. Methylene blue photodynamic therapy induces selective and massive cell death in human breast cancer cells. Intravenous injection and deep red light induces selectively kills prostate carcinoma cells. So it is a part of the chemotherapy in prostate cancer. It is also a part of the chemotherapy in osteosarcoma. So don't worry about the cancer patient. Age limit, children age 6 months and onwards up to 100 years, anybody can take methylene blue. What about G6PD deficiency? G6PD deficiency is not a contraindication for oral, nasal, and nebulization because it is not that high much low. Only for giving intravenous, we should rule out the G6PD deficiency. I would like to bring to your notice to this paper published by Heidelberg University Medical College from Germany. They did this study in a country named Burkina Faso, and the study is published in 2005. And in Burkina Faso, 226 children from age 6 to 5 months with uncomplicated falciparum malaria were treated in this country. The methylene blue dose was 12 milligram per kilogram of body weight. I mean, we are just talking 1 to 2 milligrams of per kilogram. This is 12 milligram in children of 6 to 59 months. For 3 days, they were given this dose. Including 24 cases of G6PD deficiency. That means even in G6PD deficient children, they give this much high dose. And the conclusion is that even in G6PD deficiency, methylene blue is safe for the treatment of uncomplicated falciparum malaria. So even in G6PD deficiency and even in children, you can give methylene blue without any much fear. Pregnancy and lactation, liver failure, and renal failure. Can we give in these conditions? Yes. To gargles, nebulization, and nasal drops, there is no contraindication. Avoid intravenous or large doses per oral. And remdesivir and intravenous methylene blue can be given on the same day. If remdesivir is not available, consider methylene blue as a poor man's remdesivir and you can use it. I know several physicians who use methylene blue when remdesivir is not available or when the patient is not able to afford or find remdesivir. There are many people who ask, what about the normal gut flora? What will happen to it? Because methylene blue will kill all the gut flora also. So I ask them, do you really care so much for your normal gut flora? And if you are really caring for your gut flora so much, then you should not be drinking Coca-Cola or these drinks also, because all these things also kill your normal gut flora. So forget about gut flora. You want yourself and your family to be saved for coronavirus. So just ignore the gut flora. And gut flora is so easy to replace every day by taking probiotic food like Amul Masih Dahi or Greek yogurt. Or there's so many probiotic food which are available which will replenish your gut flora. And your oral flora gets replenished almost every day whenever you are eating or when you are speaking, because from air the bacteria keep on entering the commensals. And you can add your gut flora by using Visilec and Visilec GG, various formations of lactobacilli. Can we take methylene blue after taking vaccine? Yes, you can, but stop methylene blue 1 day before and 5 days or 6 days after the vaccine shot is taken. Otherwise, methylene blue will oxidize and destroy the vaccine viruses also. It does not identify whether it's a live virus or dead virus, whether it is this or that. It just sees the RNA virus and oxidizes it. So once the immune system in 5-6 days has recognized the virus, then methylene blue does not hamper or retard the formation of gamma globulin and antibodies. So after taking vaccine, restart after 5 or 7 days, because our vaccine is only 70% protective, whereas methylene blue is 99.9% protective. So just don't rely on the vaccine, continue methylene blue again with a gap of about 5 to 7 days. Chances of any major reaction or anaphylaxis? No. In fact, methylene blue is one of the drug of choice for reversal of anaphylaxis. There's no major side effect or reaction reported. Not a single death has been reported. How long it can or should be taken? Yes, till the pandemic is over. It can be taken lifelong. I know there are many countries like Armenia and Romania where there are many societies, there are many social groups who take methylene blue from birth till death every day. And the estimated end of pandemic for India is December next, not this, but the next December. So 18 more months to go like this. So continue taking it and don't worry about continuing. Just read this study published in 1975, methylene blue in renal calculi, results of 5-year study. Now in this study, I'll just like to remind you here that before 1975, methylene blue was used to dissolve calcium oxalate renal calculi. So they were giving 65 milligrams of methylene blue per oral 3 times a day. This study was done on 68 patients and it was given for 5 or more years. So 65 milligram 3 times a day means 195 milligram per day. We are talking about 4 to 5 milligram for prevention. So 195 milligram per day given for 5 or more years. This was the therapy for renal calculi. So forget about the long-term use, continue till the pandemic is over. Will it cause any kidney damage? No. Will it, I have kidney stones, can I take it? Yes, in fact, up to 1975, methylene blue was used to dissolve renal calculi. So you can read this study. And there is a study, short-term beneficial effects of methylene blue on kidney damage in septic shock patients. Will it cause any liver damage? No, methylene blue improves the hepatopulmonary syndrome, which occurs after the cirrhosis of the liver because it breaks the liver fibrosis. Methylene blue protects liver oxidative capacity after gut ischemia and reperfusion. You just read about methylene blue and you'll find so many papers and so many references. Will it cause any brain damage? No. In fact, it is neuroprotective, liver and kidney protective. This is the paper about neuroprotective effect of methylene blue in vivo. Protective role of methylene blue in Alzheimer's disease via mitochondria and cytochrome C oxidase. You can read all these papers. Methylene blue modulates Huntington aggregation intermediates and it is protective in Huntington's disease. You can read all these papers. Potential Alzheimer, Parkinson's cure found in century-old drug. This is a report which you can read. I have thyroid problem. Can I take methylene blue? Yes, with caution. Methylene blue increases T3 and T4 secretions and decreases TSH. So those who are on those who are hypothyroids methylene blue will be helpful for them because it increases the thyroid hormone secretion and decreases the TSH level. If a patient is hyperthyroid, then their thyroid level will increase and they have to moderate that dosage. Methylene blue is an endocrine modulator, interactions with thyroid hormone. You can read this paper in detail. An increase in the blood thyroxine level after methylene blue in rats, the interaction with carbimazole. Can a patient on antidepressant take methylene blue? Methylene blue is a serotonin analog and monoamine oxidase inhibitor itself. So those who are on antidepressants of SSRI group, serum serotonin reuptake inhibitor group, they should either avoid methylene blue or adjust the dose of their own drug, decreasing their drug in order to prevent the euphoria, the excessive mood elevation by double antidepressant effect. And this is the question which we are quite frequently asked. Why AIMS say no role of methylene blue in COVID-19? Why governments and WHO are not advising methylene blue? Now, let me explain this. By saying this, they have done one of the biggest disservice. But we cannot help for them, for those who want to remain willfully ignorant. You know, they said there's no role of methylene blue in the management of COVID disease, but we know from Dr. Alamdari and from Dr. Bhushan and from all their publications that there is a role of methylene blue in the management of COVID disease. But I don't know why, for some or the other reason, we cannot explain here. They have come out with this. But here I would like to explain you that this is not a directive. This is not an order. This is not a guideline. This is just an FAQs. So what they have done is they have gathered the questions which they have received from 22 AIMS ICUs. The doctors who are working in AIMS, 22 AIMS, there are 22 AIMS in India, their ICU doctors, they ask the questions to the principal unit, AIMS Delhi, and the Delhi AIMS gave them this answer. So this is just a list of FAQ. This is not a directive. This is not a guideline. This is not a stipulation. So any ICU or any MD physician outside of AIMS ICU can, with his conscience and his knowledge and his reading, use Methylene Blue for the management of COVID. It is not illegal, and nobody can do any legal action against you if you use Methylene Blue for the management of COVID. And if you read about Methylene Blue treatment for COVID-19, you will get 18,80,000 results on Google, and there are so many papers. And as our Swami says, that when the rain comes, the rain of the knowledge, all these vessels will become full of water, but these vessels will never get filled up because they are upside down, they're closed, they're closed. So with this, I would like to end my talk. Of course, this is not quite the end. We still have to go an extra mile. For a doctor, there's always an extra mile to go. And here I'd like to stop sharing my screen. And if there are any other more questions, we can have a panel discussion. Once again, we still have about 5-10 more minutes for the discussion. Dr. RC and Dr. Golwalkar, please.
I think Dr. RC sir has to leave. He had some urgent work.
Okay.
Yeah, so I think he has left this webinar. Sir, I was just looking at a few questions which came by the audience. I think most of the questions are related to the dosage. They are related to about diabetes or hypertension, pregnancy, children. Only I think one question which we have not talked more elaborately is what is the role, although you have shed some light on that, the role of Methylene Blue in mucormycosis as a prevention and as a treatment. So what will be the answer to the audience?
Is a very strong antifungal agent. So what I have nowadays to prevent is, instead of humidifier, if you use it Methylene Blue as a humidifier, you will get Methylene Blue continuously in the lungs. At the same time, it will clear the lungs, water. Or humidification will be free of any fungal. That's what advice I can give, and it is very good and very strong antifungal drug. It is. Rather, it is antifungal, antiviral, and antibacterial. And to prevent ICU, this is what I will advise. I've been using it. Instead of humidifier, I'm using Methylene Blue as a humidifier.
Okay. Okay. And sir, because currently the new strains are very active and dangerous. So what is the role of Methylene Blue in newer strains which are coming to India?
See, if I'd like to answer this question. If the Methylene Blue is used in the right concentration, it does not have anything related to its genome. See, the strain variation is by the genome, whereas Methylene Blue oxidizes the lipid layer of the virus and the spike protein. So it will oxidize and open up any virus as if you are opening up the virus to do RT-PCR in a laboratory. Right, so it will oxidize the virus and kill it no matter what virus it is. Forget about the variant, it will oxidize even chikungunya or dengue virus also. So as far as the mutant or variant is concerned, I don't think Methylene Blue, I mean, any virus will develop a resistance to Methylene Blue in the foreseeable short future. No. So, Dr. Golwalkar, would you like to say something?
No, very rightly. See, in the first viral load, I'm working unguarded. I'm using myself as a guinea pig. Second viral load, still I'm free from any infection, or rather my staff and my colleagues and neighbors They are free from all they have not been affected by any viral. Even in third load, let it come, I'll face it, will try myself. Yeah.
I think,
Dr. Bhushan, Dr. Alamdari, I would like to repeat here that Dr. Golwalkar at the age of 70 never uses PPE kit, never uses mask. And none of his staff, he has about 100 people, staff working in his clinic and hospital. And from 9 a.m. to 12 midnight, they are working 15, 16 hours a day. And none of the staff, nor sir, at the age of 70, nobody has developed infection.
So we should make a case study, and this should get published.
Right.
Yeah.
That's one thing. So
I want to ask one question.
That will be a great case. That will be a great case. Secondly, when we are talking about the COVID and the remdesivir, I would just like to tell one thing, that remdesivir does not save the life. So just advise your patients that they should not run behind it. You can do the solidarity trial.
Right.
Just read the solidarity trial, and it says that it does not save the life. And so it's getting black marketed, very costly. So just, the people should not get, very much bothered about it.
For that matter, in last year or till now, I have never used fluvirapyl, remdesivir, tocilizumab, or anything else, excepting methylene blue, dexamethasone, antibiotics, acetylcysteine, and nebulization. Not single other drugs I've used. Rather, they are not available in the chemist shop nearby.
Dr. Golwalkar.
And yes, and not. I said, ask them, instead of spending fluvirapyl 2,000 rupees, get one nebulizer. That will help you more than fluvirapyl.
Right.
Yeah, that's right.
I want to ask one question to the panelists here. And the question is that any experience of using methylene blue in cases who are posted for surgeries, major surgeries? Can we use in the same doses prophylaxis in these patients, or has to be changed?
One surgeon from Shirdi, Sai Baba, my brother told me that whenever a patient with COVID comes to him, he gives, I don't have any experience because I'm not a surgeon, I just do chest procedures, not a general surgeon, but he is operating after giving 5 days sublingually only, and he is operating on the patient. That is what my brother said from Shirdi. Sai Baba, he is working in Sai Baba hospital, that he gives for 5 days and then he operates on the patient.
Yeah, we do the same for cataract surgery. In my hospital, I do about 8 to 10 cataract surgeries every day. And we put all our patients on methylene blue 2 days prior and 3 or 4 days after the surgeries.
So you use sublingual or nebulized or nasal drops?
No, sublingual and nasal drops.
Okay. Thanks.
Dr. Kakdia, can I just share one story about my own uncle and aunt? So they were admitted in a small place in Shivpuri.
Mm-hmm.
So where one had 48% lung involvement, one had 24%. And the care was so poor that there's no hospital staff. So 10 people had COVID in the staff, they had gone home. 10 people already afraid, they went home as well. So my brother, who lives in Mumbai, he traveled to Shivpuri. He stayed with them for 12 days in the hospital with them. And I told him just to take methylene blue sublingual every day. So he cared for them and we gave them nebulization, and he stayed in the hospital in the same room and he did not get COVID. So that's a good, he did wear mask, double mask as well, just to be protective, obviously. One thing I have noticed is that you get some oral stomatitis, like somebody else said in the chat. I also noticed myself that, you develop some ulcers on the tongue, and I try to take it diluted. So I don't know whether it's something as an individual or is it something which can, just rare, or what's your experience?
Some do complain, even my wife complains. So I ask them to dilute it. You can dilute it. Because, see, 0.1% is little concentrated, but you cannot make it 0.8. That will be more ideal for the compliance. But to make a 0.8% is very difficult to explain the patient. So 0.1% is easier to understand, and you can dilute. In case if you get some stomatitis, you can dilute, no problem. Or can
0.08 you mean? 0.08 is
yeah,
difficult to make.
that compliance is better, but to explain it, to prepare it is very difficult. So 0.1, and that is actually that dose I decided because it is we have been using for diagnostic purpose in bronchopleural fistula international accepted dose. So on that grounds, I started using it because that we have been using since 1978 to diagnose in vesicovaginal fistula, bronchopleural fistula, and all the procedures in the lungs and body. So that is the concentration has been accepted. So for that reason only I started with that dose. The compliance with 0.8 is better, but to explain to the patient and to prepare it is more difficult.
Dr. Bhushan wants to share the experience, I guess. Yeah, yes, sir. Unmute. Sir, you have to unmute.
One of my friend, he is admitted in the hospital in Bhopal, and he is having 60% involvement of the lung. He told me when he was almost 10 days in the hospital, somehow they were missing my number, Selma. I was requesting the treating doctor, my colleagues from where I studied, that use this combination of IV methylene blue and acetylcysteine and vitamin C and see the results. We have seen the good results. They refused to do it. Somehow his son was adamant, and he said, we are going to give the inhalations. Whatever you want to give, you keep on giving. But we want to give the inhalation. The day he started inhalations, from second day onward, his oxygen requirement has gone down from 15 liter to 3 liter. So now he is 5 days on inhalations in addition to whatever they are giving. But they have given, anything. I mean, remdesivir and everything they have given, but no improvement. Just by taking the methylene blue, he has improved. Thank you.
Well, while acceptance of inhalation and understanding the importance of inhalation, as early as possible, if you start it, then the results are amazing. You don't have these late complications.
If the nebulization or inhalation is used for prophylaxis, do we add diolene or betamethasone or dexamethasone? No need, no?
No need. No.
Right. Thank you.
They are only for the patients who have developed some problem with the lung, otherwise routinely not negated.
So, sir, I think the questions from the audience has already been answered. So, if the panel wants to share anything else more on this experience on this methylene blue, we can do for the next 2-3 minutes, and then I think we can wind up.
One suggestion is there that there are a lot of cases of COVID in India at present, and if we can make out good studies out of it, of using methylene blues in prevention as well as treatment, and publish them, it will be an eye opener for whole of the world.
Yeah. Yes, sir. Actually, yesterday, Dr. Bhushan and I was talking on the phone for almost 45 minutes, and we were discussing the way forward for methylene blue. So I think Dr. Bhushan would like to share that. Sir, you're on mute.
Sorry. The thing is that we use the product or we use the medicine, but we do not, get the time to write that. Even a case study will be very, very helpful, because if that get referred and referenced, then people, take that point as a point of study. How myself and Dr. Alamdari got connected last year when I was treating my patients, and all the patients were getting whatever they were getting at the time, they were still suffering, and they were just wanting the more oxygen. They were not getting it. So I searched and looked into, and then I got Dr. Golwalkar sir's video. I looked into that, and I thought, oh yeah, why not try? I kept my mind open. And that's how I got Dr. Alamdari's, study, and then we got connected. So that's how it has happened. Similarly, I got connected with Dr. Kakdia. In the same way, I gave him a call and told him that your presentation was good and I would like to learn more. So we should keep mind open and to see what best can come.
Yes.
My suggestion is that if we can make a group of we people here, doctors, and then we treat these patients and we make our own studies, we make our
True,
own
true.
protocols, we can do
Yes.
much better.
Yes, sure,
So,
for
as I
sure.
was saying, my friend in Ahmedabad is doing a case control study at the moment, 100 patients with and without treatment. So I think we should involve him very soon so that he can share his experience. And
Sure.
also, he would also like to do an RCT, but I think the permissions become a problem. And there are so many patients at the moment in India, it won't take very long to actually do a RCT with a 3 to 6 months follow-up, because there are so
Yes.
many patients at the moment who are actively suffering.
Sure, sure. Very
Now,
true.
luckily in Gujarat, the nearby villages and different places, the local senior people have started doing a job. They're distributing to their villages, and results are coming today only in the newspaper. When there was no vacancy, few days back in the hospital, government hospital, 324 beds are vacant today. The result of
Right.
mass acceptance of methylene.
That's the awareness we have to create, and I think just by keeping these kind of webinars, we will be involving more people, and we can ask people to participate. So that panelists can change. Not necessarily that I have to be panelist next time. Somebody else, like the people who have published the papers, they can be part of the panelists.
Absolutely right.
So yeah.
May I tell one thing, please?
Yes, yes, yes.
Yeah.
I forgot to tell that after the clinical trial phase 3 that I did it, our university has did the permission and instructed to all hospitals in our city to use this as a drug for treatment of COVID-19 patients. Already we have this permission from our local area COVID-19 committee in our province that it should be used for COVID-19 patients for treatment of them. And I think if we will unite it and run a clinical trial, large clinical trial, we can reach to this point that show this methylene blue are really effective in treatment of the patients, and by this we can save many lives, I think. It's very important to do the fast and rapidly in order to disseminate this matter in all the world to save many lives, I think. It's my honor to join you, and it was very nice to talk about with all of you.
Same here, same here, same here. Thank you very much to all of you.
Thank you very much.
So, sir, I would just like to inform to the audience that this session was live on YouTube, and there is a YouTube channel called Doc Academy by Summers Life Sciences. This entire session will be there on this YouTube channel. So if you have missed anything, okay, you can watch it repeatedly. The dosage and other things, whatever you need to take from the video. So sir, with your permissions, I think there are no more questions from the audience, and the way forward for Methylene Blue is to we unite together and try to publish our research as much as possible. Maybe an RCT will take time, but at least whatever has been researched, we can definitely go into publications, and I think then the acceptance by the entire world will definitely increase. So on that note, sir, means our management is also so enthusiastic to listen your talk to Dr. Golwalkar, Dr. Kakdia, and Dr. Anamdani, and all these panelists. They have joined the webinar at 10 o'clock, and they're still there with us. And I would like to request we have our chairman, Mr. Pranav Shah, with us. So I would like and request him to give the vote of thanks.
Thank you, doctor. Thank you. I mean, it's been a wonderful session, very, very informative, very, very scientific. And as you said, I mean, you get glued to the session. You know, once Dr. Govalkar and Dr. Kakdia start speaking, you can just not leave the session. So, of course, very, very clear that methylene blue is an evolving therapy. And I do agree that we need more RCTs, we need more papers published on this, we need more studies. But the clinical experience of all the panelists is overwhelmingly in favor of methylene blue. Dr. Kakdia just said that he has received results of 99.9%. In fact, the patient load in ICUs have reduced to almost 50%. And of course, Dr. Alamdir also very clearly said that patients were not responding to favipiravir and remdesivir. He was able to save 40 patients using methylene blue. Dr. Govalkar, of course, is a pioneer in this, and he says that he's been sort of conducting himself as a guinea pig, and he's been treating 100 patients every day for the last 1 year, and that too without a protective mask, and neither him nor his staff has sort of been infected with COVID. So it's been a wonderful session. And I do agree with Mr. Kakdia when he says this is a not 7 drug, you know, absolutely revolutionary. And considering the situation that we are in today, considering the situation India is in today, you know, with this coronavirus on a rampage, and we have almost 4 lakh cases every day, I think it is very important that we don't wait for RCDs, but doctors have an open mind and try this out. And I'm sure if you try this out and looking at the experience of all the doctors, in fact, I've been receiving a lot of calls from doctors regarding availability. You know, we manufacture methylene blue, and the demand has skyrocketed in the last 2 months. In fact, we're not able to keep up with the demand. So there has been a lot of acceptance widely. In fact, hospitals also have started using this in IV. So I guess, I mean, if doctors have an open mind and they adopt this treatment, I'm sure we'll be able to save a lot of patients and also mitigate the sufferings of all COVID patients. I would like to thank all the panelists, Dr. Jagdeep Kakdia, Dr. Govalkar, Dr. Alamdari, Dr. Bhushan, Dr. Saurabh, Dr. Nitin, for being present in this session. I know the international panelists, they are sort of attending this session at very, very odd hours there, but I'm really grateful to all of you, thankful to all of you. And once again, thank you so much and have a great day. Thank you.
I would like, before we continue, I would like to add, Ms. Pranav, would like to add 2 things. One is I would request you to be in touch with Dr. Alamdari, and if with his permission and with his patent rights, if leucomethylene blue can be produced in India, just check on that feasibility, what are the DGCA requirements, what are drug authority requirements for India. But if that can be done, that would be something very, very good, and it should be done as early as possible. So you have Dr. Alamdari's number now, and
yes, it's my pleasure to do. It's my honor.
Dr. Alamdari, in the interest of humanity, we would wish that you allow Samarth Pharma, if they so decide to manufacture your patented formulation for oral leucomethylene blue in India. And the second thing I would like to tell all the doctors who are present in the audience that don't wait for RCT. A randomized clinical trial would take 1.5 years. We don't have that much time, number one. And number two, a randomized clinical trial, phase 1, 2, and 3 is an expensive thing. It costs around 8 to 10 crore rupees budget. And it's very difficult for any of the methylene blue manufacturing company to generate a budget of 8 to 10 crore rupees to sponsor an RCT. And by the time the RCTs will be over, the pandemic might be over, or we might be over. So all the doctors should do just one thing or 2 things. Read the literature about methylene blue. There is enough evidence and enough publication. Don't just wait for an RCT or this and that, or this approval or that approval. Second thing, if you have any doubts, you are welcome to Bhavnagar. I will manage your hotel room. I will pay for your to and fro. I will host you and I'll make you to stay with Dr. Golwalkar for 1 day or 2 days or 3 days, whatever you wish. You just observe Dr. Golwalkar working in his clinic, treating 100 patients. So you don't need any clinical trial. You just observe to go to Dr. Golwalkar's clinic, stay there for 1 day or 2 days. And you will be my guest. I'll be hosting you once you land in Ahmedabad airport, from Ahmedabad airport to Bhavnagar, back to Ahmedabad airport, and 3 days of hotel stay in Bhavnagar will be my responsibility on the behalf of Dr. Golwalkar. Why do you want randomized trial? Why do you want somebody else to say you that this is working? You just come and see, and then try it in your 10 patients or 15 patients. If it works in your 15 patients, do your own study for 100 patients. Then if it works in 100 patients, do your own study of 200 patients. Why do you want to rely on somebody else's study? Do your study. So we should all be open-minded. Read the literature. There is more than enough. If you start reading literature about methylene, your entire life will be gone. Your life, the remaining working years will be short for the number of publications which are there on methylene. So thank you again for this wonderful session to Samarth Pharma. I really am extremely thankful to Dr. Alamdari for being present from the beginning till end, and also extremely thankful to Dr. Bhushan for introducing me to Dr. Alamdari, and Dr. Saurabh Goyal for introduction of his friend in Ahmedabad and for coming up to this session. And of course, Dr. Golwalkar, the pioneer of it.
Thank you.
Good
Thank you so
luck.
much. Thank you.
Thank you. Thank you so much.
Thank you.
Thank you so much. Thank you.
Thank you.
Good luck.